സുകന്യ ഷൈജൻ സാർ ജോയിൻ ചെയ്താൽ നമുക്ക് സ്റ്റാർട്ട് ചെയ്യാം കേട്ടോ.
Okay, Miss. Good morning.
Okay. Good morning, sir. Shall we start?
Pardon?
Shall we start the program?
You can.
Good morning, everyone. Today we observe World Mental Health Day 2020 under the theme Mental Health for All. The COVID-19 pandemic found the world unexpectedly at a rapid rate. With the advent of drastic lockdown measures and the new normal of social distancing, the mental health of millions have been compromised. Though the pandemic has increased the spotlight on mental health, there is still a lot to be tackled to ensure that mental health is a reality for everyone, everywhere. With that, I extend my warm welcome to everyone present on the dais. A day without prayer is a day without blessing. A life without prayer is a life without power. To invoke the Almighty's blessings, I invite Christy Joni for the prayer song.
എന്റെ പാദം ഇടരാതിരിക്കുവാൻ എന്നും ഇന്ന് നരകണമേ എന്നും ഇന്നും നിറയും വെളിച്ചമേ പൂവിലൂറുന്ന പുഞ്ചിരി നീയല്ലോ പുസ്തകം തരും ജ്ഞാനവും നീയല്ലോ മാടവും പൂമണി വീടയും തുല്യമായി തൊഴും ശക്തിയും നീയല്ലോ വെളിച്ചമേ
Thank you, Christy, for that soothing prayer. The backbone and coordinator of today's program, Dr. Suganya B. Menon. Ma'am, I invite you to welcome the gathering.
Good morning. Today we are observing World Mental Health Day. In these pandemic days, mental health is a major concern for each and every individual. So we have to work together to enhance the mental health of people. On this occasion, I welcome our principal, Dr. Shaijan Paul, who is the mentor and the backbone of all our endeavors. His charismatic and never say die spirit have always been our morale boosters. I welcome you, dear sir, to this webinar.
Thank you.
We got a vibrant personality as our chief guest and resource person, Dr. Mohammed Abeer, who is the Senior Counselor of Indian Institute of Technology, Kharagpur. He is also our alumnus. He is a down-to-earth and jovial personality. On behalf of the Department of Psychology and all delegates, I extend our heartfelt welcome to Dr. Mohammed Abeer. Dr. Milu Maria Ando, head of the Department of Psychology, is always with us giving creative suggestions and advice. She is a constant motivator for all of us. I welcome Dr. Milu Maria Ando to this webinar. It is my immense pleasure to welcome all the students of other colleges and professionals to this program. I also welcome all teachers, non-teaching staff, and students of our college to this program organized to commemorate World Mental Health Day. Let this program initiate a new normal in the field of mental health. Once again, welcoming all of you to this program. I conclude. Thank you.
Thank you so much, ma'am. Now I invite the cornerstone of our college, respected Principal Dr. Shaijan Paul sir, for the presidential address.
Respected Chief Guest of the Day and our former student, Dr. Mohammed Abeer, Head of the Department of Clinical Psychology, Dr. Milu Mariando, Organizing Secretary, Dr. Suganya B. Menon, Student Coordinator of this program, Stefina Rose, my own colleagues, both teaching and non-teaching staff, participants from other institutions, and my dear students. As you know, and as it was mentioned in the welcome speech by Dr. Suganya B. Menon, World Mental Health Day is observed on 10th October every year. Actually, this day is observed with the overall objective of raising awareness of mental health issues around the world and mobilizing efforts in support of mental health. And now, I'm very happy to see that this day is observed by the Department of Clinical Psychology with an appropriate manner. And today, we have with us the eminent scholar in psychology, the senior counselor, well-trainer, and above all, our own former student, Dr. Mohammed Abeer, who is capable of providing mental peace to all those who really wish to have. Hi, Dr. Abeer. I am really proud of you for having with us today as our chief guest. Special congrats to you, dear. Now I am very confident that during this panic situation, COVID-19, this program will certainly encourage and motivate all the participants to overcome all their mental health issues. Let me also take this opportunity to appreciate the entire team, clinical psychology, and more particularly, head of the Department of Psychology, Dr. Milu Maria, Organizing Secretary, Dr. Suganya B. Menon, and other faculty members of the department. And before I conclude, I wish this webinar and all the participants all the very best. Have a nice day. Stay safe. Thank you.
Thank you so much, sir, for always supporting and guiding us. Next, with immense pleasure, I invite the chief guest of today's program, Dr. Mohammed Abeer K, a well-accomplished man and most importantly, an alumni of our institution. He is a senior counselor at the Indian Institute of Technology, Kharagpur since 2013. He was a co-principal investigator of the MHRD-funded project on resilience in young adults and is currently the co-principal investigator of the ICMR project in mindfulness training to improve resilience in Indian college students. Sir, I kindly invite you for the inaugural address.
Thank you, Ashley. Respected Reverend Father Dr. Harshjan Prajyoti, Founder, Director, and Manager. Dr. Shailin Folser, Principal, Prajyoti Niketan College, and Head of the Department, Dr. Milu Maria Ando, and Organizing Secretary, Dr. Suganya B. Menon, my teachers, other faculty members, my friends, and my dear students. Today, World Mental Health Day. I'm extremely excited and so proud to in this occasion for various reasons. I have been invited as a chief guest for Mental Health Day program at my college after 15 years, and I got this opportunity to share my professional endeavors. World Mental Health Day, it is observed on every 10th October with the overall objective of raising awareness of mental health concerns around the world. This year's World Mental Health Day on October 10th comes at the time when our daily lives have changed considerably as a result of the COVID-19 pandemic. In this occasion, for your well-being and others, I have a small message that I wanted to give to my students. That is actually practice kindness. How much the amount you practice kindness, that is, I can say that will remain forever, for years. I just wanted to say a small story. A boy is coming from very low socioeconomic background. He got an admission in one college in Ivory district, maybe 130 or 140 kilometers far away from his home. The parents was not educated, just 5th grades, both father and mother. And this is a completely new experience for them to travel next district to taking along with his son for this admission process. And they were reaching the college just prior to the opening day. Maybe it was actually a Sunday evening. They were reaching the campus. The campus was very silent. And they were so afraid and so anxious. So this is the college my son is going to study. Then they found a white-haired priest there. And he welcomed the family. And he said, no need to be much worried about in this campus. No need to be worried about your son. And you can stay here today night, maybe a couple of days. And he actually arranged all the facilities there to stay there at the night. And after that, the mother was saying that, I'm so happy, I'm so relaxed because of this priest, this father. That mother is actually no more today. She was fighting for cancer for a long time. Finally, she left the world. That's my mother. And the boy was, definitely, it's me. And the father was Reverend Father Harshin Prajyoti. In this occasion, I express my deep gratitude toward our father for his kindness. Maybe he forgot this incident, but still it remains years. Maybe I'm talking after 18 years today about this. So this is actually, I'm just telling you an example of kindness. It may be a small act for the people, but the impact is actually different. So in this special occasion today, I'm actually sharing, or I'm actually requesting my students, please practice kindness. By these words, I'm officially declaring inauguration of this program, World Mental Health Day 2020. Thank you.
Thank you, sir, for the insightful words. As a token of gratitude, Dr. Mohammed Abeer, sir, we present you with a humble gift. It's a pencil portrait of you from our department. It'll be soon presented on the screen. Thank you, sir. Hope you like the gift.
Yeah, of course, very beautiful. Who actually done this? I really wanted to see the face, please.
It was done by Deepika Shivanandan.
Oh, thank you, Deepika. I'm so happy. I'm so glad. I'm so happy. So it is wonderful. It's very beautiful. Please share this to me in my email ID. Of course, you might know it.
Thank you, sir.
Yeah.
Next, I cordially invite the head of the Department of Psychology, Dr. Milo Maria Anto, for the felicitation.
Respected founder manager, Father Dr. Harshin Prajyoti, Principal Dr. Shaijan Paul, Organizing Secretary Dr. Suganya B. Menon, Student Coordinator Ms. Stefina, my dear colleagues, dear students and participants from various institutions, and today's main speaker, Dr. Mohammed Abeer. Warm good morning to all. Today, all over the world, mental health is being observed with the motto of mental health for all, great access everyone, everywhere, in the context of the pandemic situation. This pandemic posed several challenges for all, starting from children to old age people, students to teachers, health professionals to mental health professionals, etc., etc. The whole world has been shattered due to the sudden and unexpected emergence of the COVID-19 virus, and the situation is continuing since the past 7 to 8 months. Let us learn new skills in life without being disheartened to overcome these challenges. With this mission in mind, Department of Psychology organized today's webinar on the topic Mental Health Care in College, Clinical Services and Crisis Intervention. As the education sector is a major with online classes, virtual interactions, etc., this topic is relevant to discuss among academic community. Today's speaker, Dr. Mohammed Abeer, who is currently faculty of IIT Kharagpur, I would like to proudly introduce him as alumnus of Department of Psychology, Prajyoti Niketan College, and as my student. He is a role model for all the students. The way he embraced hard work and his perseverance made him one of the national figures in this field. Dr. Abeer, once again, with pleasure, I welcome you to this webinar. With gratitude, I remember our principal, Dr. Shaijan Paul. Without his support, this program would not have been a fruitful one. Dr. Suganya B. Menon, the organizing secretary, with her tireless effort, made this program a grand success. The way she coordinated each and every aspect of the program is worth mentioning. I especially appreciate the efforts of students under the leadership of Mr. Fina, and especially thank the technical support provided by our staff and I appreciate my colleagues, Dr. Naismedi, Dr. Saumya, Dr. Jaya, Dr. Lijo, Midhu and Limna for all their services. I especially mention the motivation provided by IQAC of our college. I wish all the success for the program. Hope all of you will benefit and take a great thought from today's session. Thank you all.
Thank you so much, ma'am, for your inspiring words. Next, I invite today's resource person and also our chief guest, Dr. Mohammed Abeer K, for the most awaited part of the program, that is the webinar. He would be talking on mental health care in colleges.
Thank you, Gifty. Thank you, Miss. Right. So today, our session is actually college mental health care, clinical services and crisis intervention. This field, I think it's actually completely new for you because I do not know that already existing in our curriculum, Indian curriculum. You probably may know about school psychology and counseling psychology, like that. But college counseling is actually a new term, I think, I feel. So still there are very less books about the system, the process of college counseling. I have chosen this topic because I thought definitely this is a good day we can familiarize among our students. Before this, actually talking about college mental health counseling, I just want to give you a brief background of myself, how actually I have reached here. I think this may be helpful for you. I am actually in a humanities background, 12th standard, 11th and 12th I was in humanities, and I have one subject on psychology. That time my intention or my any kind of dream was not become a psychologist. I just got there as one of the course of psychology. Fortunately, I got an admission to the Premier Institute in Kerala towards our college, Prajyoti Niketan College. I was so proud. I reached a college and BSc Psychology I have done. All the faculties were there, Miss was there, experience was there. Our senior faculty, Police sir, Miss Paul sir, the team of psychologists. That time, I know only one clinical psychologist, that's our Monsi sir. Then I was not, I don't know how, I was not that much so very smart in academics. Not in smart in academics, it means I was actually smart in all other activities except academics. I have to say it that way. I was enjoying my college, 3 years. And I have somehow secured a good, decent score in my final, grades and final semester. I was first class, definitely, just first class, and just 60 plus was my, I can say, my marks. But that time, I think getting 70% plus or 80% plus, there are some exceptions. Yes, we have one of my colleagues also, classmates, she got 80 plus. But that is very few members will get it. But otherwise, most of the, our students are around, definitely it's a social science. You will get around 60 plus. I was secured the same, and I'm also very happy. Enjoyed my life, got a decent score. And I went to Barrier University, Coimbatore, and I got an admission of applied psychology there in clinical stream. That is actually somehow I can say a turning point from there. Gradually I started to like psychology, and the experience from there somehow changed. Why I'm telling you this, currently you all are BSc psychology students are there, MS students are there. No need to get much confused your field. These all are your experiences. And you don't need to focus a particular area at present, but you need to get exposure in all the areas. Like today our session, college mental health. After this, I got admission there. I was actually completely clinical, stream, and we have psychotherapy, psychodiagnostics, all these things are there. Gradually, my interest was just improving. In the last semester, we have an internship. I went to KMC Manipal, where of course I have seen your Milan is there. That time she was in I think graduation convocation. I think I have seen there. She was just graduated from there. But that experiences in Manipal is actually that's a new experience. The way of we are seeing the patient, the way of seeing the cases, case management, meeting, case discussions. We were there only just 6 months, maybe 4 to 5 months, but the experience was tremendous. I can't share everything here today, but experience was totally different. We have some posting in, maybe your madam already have shared some of the experience, but I'm also just adding that. We were posting under some MPhil scholars, already MPhil scholars are there, so we are actually under them, and we are attending, seeing the cases like that. And we have posting in Udupi Hospital, and Dr. Bhatt sir, and Dr. Shankar sir, and us sir, all good psychiatric team, and Kumar sir was there, clinical psychologist, he's also a veteran in the field. Good experiences there. That's actually my clinical experience, I can say. That was actually. After that, the case studies, we have to produce 10 case studies. I'm just telling you, my students, I was sincerely working for that case studies. Each case is actually, that was already taken by the MPhil scholars, but along with them, I was also with a short book. I'm just noting. Whenever they are also noting, I'm also actually, whatever they have, taken, I also have taken the same notes, and I have made it. My guide was, supervisor was Dr. Anilakshmi Narayan from Barrier University. She actually, I can say, the way how I was writing the case studies, she helped me a lot. In the last semester, we have only that and plus Viva. So Viva is actually the final for us. Viva is based on these case studies. Fortunately, I got, this is not I'm saying that, Abeer is actually very good at thing and simply, praising himself. Not like that, this is a fact. Out of 250, my mark was 246. Because the amount I was spending on that each case studies, the amount I was spending on each, I was pakka. I know the cases very well. So any kind of questions they're asking from that case, I can easily answer it. I was very confident on it. Then my interest, of course, now finalized. Yes, I wanted to become a clinical psychologist, or I want to be working in a clinical setup. But that interest was actually not, it's not, interest will not, itself will not make things happen. That time only NIMHANS, CIP Ranchi and Delhi IPAS was there only in a few programs. very less seats, lot of competitions. And I actually attended all these places, I didn't get anywhere. But I didn't stop my to become this clinicians, or I didn't actually stop my dream, work on my dream. I was actually thinking, yes, I really, one day I will become a practitioner. That was my dream. I actually joined later. I was actually a counselor in Government Medical College, Niketan for 1 year. I was attending a lot of training, counseling training. I got it from, on the basis of the government, they're arranging some trainers like that. And I was actually improving my skills of counseling in that way. And after that, I got a PhD admission in Bharati University. And that's the same guy, Dr. Lakshmi Narayanan. And I got a fellowship also. And I didn't apply other places because, MPhil program, because it was too much fun. My family cannot afford. At that time, we couldn't able to afford that kind of money and that much of money. That's only the reason I didn't go other places. Anyway, I left my idea from there. I joined my PhD. But PhD, my area of research was actually mostly, the area was resilience, psychological resilience, and my specific research on academic resilience in minority students. And I was in a fellow, UGC fellow, working college students. I was posted, I was actually getting, taken my data collection and psychological resilience intervention in Valpari district, Valpari, and I think you might know Valpari, maybe 100 kilometers far from Hyderabad, very rural place. I was there 6 months, and I was actually interacting with college students. Then I understood that this group is actually needs some kind of help. This group is actually maybe excluded from the mainstream. And why this group is, people are giving much attention about this group, college students. There are school counselors still, yes, it was some of the school counselors already, government of Kerala, government of India has already started to getting school counselors, but college counseling, at that time I couldn't find anywhere. Students also, I just went for some intervention programs for resilience building, but gradually students are coming and talking with me, they are sharing their problems, they are sharing their personal issues, they are sharing their family issues. And some of the students I found there are classic depressive symptoms. It is there. And we couldn't find it, we couldn't do anything. I also was very helpless. I was in a very couple of months I was there. I couldn't spend much time on it, with students. But I understood, I understood this field need to do something. And now, somehow I completed my PhD, and I was working in Lisa College for 1 year. From there, we have started, based on my experiences, we have started a counseling clinic there. It's not only for the students of Lisa, it's for open, was open for public also. We have conducted learning disability clinics. That time also I am seeing this kind of one people are saying you can do, some people say you cannot do, you are not clinical, you are in counseling, blah blah, all this kind of, you are in BA English, BS English, MA English, MBS, it's all rubbish. I'm just telling you, my students. Currently, I am working in this field, and I in the Institute of Technology. I applied this position, that was also very funny. I just applied from Lisa College. My dream was definitely working in a premier institution in India. Now, what is the highest position? I wanted to get that. And I applied that position, and that time I have submitted my PhD thesis. Still, I don't have PhD degree. MSc, the qualification for this position, still MSc psychology plus 2 years experience. Okay, relevant experience working in the college setup. That's what they were asking. When I came here, most of the people is actually MPhil people are there, and PhD people are there. I'm only the person that kind of just in MSc, plus PhD thesis just submitted. I have a big PhD thesis in my hand. Along with it, I just approaching the interview board. They were asking a lot of questions. They were asking maybe definition kind of questions sometimes, but I answered all the questions based on my experience in the field. My experience working with our adults, our like your age group, of course, teenage age group, your age group. And they were so happy. I got this job. And here I can say that it's somehow that time itself it's established. In that group, the position is counselor. Currently, I can say that we have 6 counselors. 3 are already from MPhil clinical psychology background, and rest is actually background like me. I mean, MSc applied psychology or clinical experience and all. After 3 years, again I applied for a senior position in a fresh interview here. Fortunately, I got this position. Now I am the head. I mean, senior counselor, point of contact of the counseling center. So we have a big team. I told you, counselor, psychologists are there, plus psychiatrists are there, 2 psychiatrists are there, and we have some other administrative people are there, like that. So this is my journey. Why I'm telling you this thing in this occasion, because you are students. It's not like teaching college counseling, so I have chosen this topic. I came here. I wanted to share my experience with you guys. You need to get exposure in all the areas, whatever you like it. Don't finalize, don't choose, don't confirm your area. Just passing. And once you will reach that exact position wherever you wanted to become. That's what actually my experience here. Okay, anyway, so we go for this presentation. College mental health care. So I think in this my experience when I was sharing with you itself, I think you got some idea about how this position is very important. Could you able to see my slides? Okay, thank you. So college counseling in India. In 2012, MHRD, currently we can say that our Ministry of Education, Government of India, constituted a task force on prevention of suicide and promotion of wellness in college. Why there actually was too much of interest came up? Because number of suicides was increasing in colleges or campuses in India, especially in premier institutes in IIT. Then they constituted a committee or task force. They actually conducted a data collection in different IITs in India, and they gave their own suggestions and recommendations. Yes, appointed counselors or mental health professionals in the field. And then they have finally highlighted need for a counseling center in college campus across India. So in this position, I already know, yes, this position is very important, but still, I also even thought about why this position is actually that much of, still, because in IIT, all the students are, we say they are actually final, they are very intelligent, why we need this thing. And still, we have other colleges. I was also a college student. We also have students, those who are undergoing some kind of stresses in their life. Of course, breakups, you probably have seen it. They are managing themselves. But how this system? When I joined here, my notion about this field is actually again changed. because suicides are still it is happening. So I'm just asking you guys, why this position is actually very important. Why people are, college students, they are actually committing suicide. In that way, you can easily understand why it is happening. I just give you just 30 seconds because we don't have very less time. If anybody, please just unmute your mic, you can say it. It's very easy for me.
Sir, I think it is because this stage we have heightened emotions, so we are more often to do things without thinking twice, and it is also a transition period from a school life to a college and into being an adult. So which could be stressful and anxious to most people. It's probably because of that.
Thank you, Ashley. That is I can say it's a wonderful answer. There is no doubt about it. If any other people, any other students, anybody can answer this. My session for all. I really wish to, from students only, students, PG, UG, PG, and PhD students. One more answer actually. We don't have it, we have very less time. I also have another program after this session. Please, one more. Who's the smartest or smartest girl or smartest boy? Our campus or any other campus? I mean, we have other students also here.
So,
Yeah. Please say your name and college.
yeah,
Introduce, yeah.
maybe because they are not passionate about the future.
Okay.
Maybe,
Yeah.
probably.
Okay. Right. You were right. Actually, there are a lot of reasons for this, if you go with the reasons. But I can say the main reasons, this kind of what Ashley was saying, this emotional instability, all these things there, the way they are in a transition period. And what Muhammad Hilal also said is also right. But I can say that, so see this slide. Can you able to see this slide? This is a timeline in years showing the development of psychopathology across lifespan. So there are 1 to 6. Already I just excluded because I thought it was not necessary for you. So 6 years, 8 years, 10 years, till 20 years it's there. So you can see the manifestation of each, psychological disorders, the age on the basis of the age group. So social phobia, ADHD starts from around 6. I mean, starting in the sense it's going to be diagnosed. And OCD and anorexia, and initial increase of suicidality for males, schizophrenia, bipolar disorder. See the age group. This is another slide. You can see panic disorders, depression, bipolar disorders, schizophrenia. See the age group, everything in a straight line. So this is the answer for this question. Most of the psychiatric disease, the first manifestation is actually in this age group. So, is it interesting? Yes or no?
Sir.
Yeah. So, in this age group is actually most of this kind of psychiatric diseases manifesting. So, we have seen as in our profession, psychology, I actually really want your response immediately so that I can, step forward very fast. Okay. This population, college students population, this is the best place. People like me or counselors or psychologists, clinical psychologists, counseling psychologists, whatever terms you are actually giving, they should be there. Their ultimate goal is preventing developing a disease or mitigating when it happens. If already symptoms is developed, we have to mitigate this effect because of our intervention. So in this age group, this is the right age group, we can do any kind of change. And maybe we are the actually, in between them, whether they wanted to become, vulnerability or whether they do not want to become in that kind of morbidity in that way. So we are actually in between. So we are actually that is our role as a college counselors. So when I joined here, I thought it's just for, people are coming for, academic pressure, relationship breakers or, other issues. But when I was seeing the cases, yes, their concerns about their stresses is same. Next slide is talk about that only. But somehow they are in a pre-morbid state. Okay, they are actually a kind of vulnerable stage. We can easily identify there are some of the symptoms are there, but we cannot go a direct diagnosis at present. We need time. But the moment our intervention is actually changing the path. You got my point? That is actually, this position is very, very highly important. Why I'm telling you in this position is highly important, not because you people are after a couple of years you should join IIT Kharagpur is a counselor position. No. You're already working in this field, you're already in the college. You need to understand your colleagues, your classmates, they may or may not have features of any of these symptoms. And you are the right people are there already. Your small step, I told this kindness since beginning, your small kindness activity, your small help seeking or helping behavior, that is actually the change. Okay, fine. So these are the most common students' life stresses: pressure to perform, heightened aspiration for achievement, family and other expectations, growing competitiveness, financial constraints, relationship issues. So these are the major concerns. You are students, you probably have seen a theoretical framework, biopsychosocial model. Do you know biopsychosocial model?
Yes, sir.
Okay. If anybody, please just briefly, if you can narrate what it is, it would be great. So others also can able to understand if someone is not understanding it. What it is?
Yes, it's basically like the biological, social, and psychological factors influence our health.
Of course. Thank you. Thank you. So that is biopsychosocial model. So biopsychosocial model talk about biological factors that can be genetic factors, inheritory, all these things. Plus, their biological vulnerability to get a disease, plus their psychosocial factor, their psychological status, their coping mechanisms, their behaviors, their cognitions, their cognitive distortions, or cognitive biases. Plus, their their social factors, their parent, other social factors, their financial status, or other psychosocial stresses like what I have mentioned here. So this all is actually combined, is actually having an impact on their mental health. Here I have mentioned relationship issues. You also have seen a lot of relationship issues, a lot of relationship breakup. Everybody is going to be depressed. Yes or no? No. Everybody is not going to be depressed. Some people are going to be depressed because they are high vulnerability to get any kind of disease. So that's what I'm saying, that also because maybe other factors also is contributing factors may be there. We don't have any kind of blood test or any kind of other biological factors test to easily understand this disease. We have some limitations in this field. We cannot directly know it, especially when the symptoms are developing. We cannot even identify that. Yes, we have some very advanced scanning techniques. Everything is there, but still there are a lot of limitations for all these kind of diagnostics. And we have psychodiagnostics tools out there. Somehow we will get some hints, not completely diagnosing to the way we are getting. We will not get it. I'm audible now?
Yes, sir, you're audible.
Okay. I think
You're
someone is right. So this is actually happening here. Students' life stresses, these biological factors, all are there actually comparing taking a decision. And also adding in this population, the suicides. College population, I can say that second leading cause of death is actually happening for college student is actually suicide. First is actually what?
Accident.
Oh, Diana. Oh, Sophia. Yeah. I think you all are very active. I really like active people because everybody is active, but they wanted to express their emotions. Okay, right. So the second leading cause of death among these college students is actually suicide. So all these reasons, this position is very important. So when I joined here also, I found all these features are there among our students. Now, we need to understand that what about this field, college counseling, in the worldwide? This is there are a lot of associations are there. But these three, the Association for University and College Counseling Centers Directors, the JET Foundation, and Center for Collegiate Mental Health, CCMH, in Penn State University, Pennsylvania. So this all establishment, organization is actually from US. There are other institutions also there. But these are the leading institutions. That's what I actually have chosen only for you. So if you wanted to go for further research or further, if you get any information about college mental health counseling, these are the institutions. These are there. You can check about their websites. You can understand that what is actually happening. They have given a lot of toolkits for counselors, for people those who want to help the other their fellow students. Like gatekeepers, training programs, modules, all are there. So you can cross-check this. The Center for College Mental Health also is well established. And the system what we follow in Institute of Technology, IIT Kharagpur. Here we follow Center for College Mental Health, same system, same model, same process. So why I'm telling you, these are the institutes already established. You can check your website, this website. And if any of you guys are interested to study in abroad, check about their sites. There are a lot of courses are there. If you want, you can join there. Because when I was in college years, because we don't have much idea about studying in abroad. Now I really wish to, but I couldn't be able to make it. That's what I'm saying. If you want to study, please work on it. Only the thing is you need a wish, you need to spend some time on it. There are a lot of good courses are there. There are a lot of good trainings are there. If you want, you can go for the studies are there. And check about any fellowships. Without fellowship, don't go. Fellowships are there. If you get fellowship, all the expenses will get included in that fellowship. You can go there. Anyway, So this is also just think about it. I'm just sharing with you out of the box, but still. Okay. Immaculate record keeping and the role of electronic medical record and EMR. This is actually a software. All our records we are keeping in our counseling center is actually based on this software. This is very well-established software, and around 1,000 plus counseling center all over the world is using this software. Same software. This is actually under this this CCMH, Center for College Mental Health. So this titanium schedule, this is if it is a very easy, I can say this is just electronic medical data. Whenever any of students are coming to the counseling center, we are actually keeping all the data in our system. Okay, it's very simple to say it, but the benefits in titanium schedule is huge. One is actually the security, because you need to understand in this field, people are very scared about, especially in this electronic age, scared about the data protection, especially in counseling data. All our appointments, pre-scheduled appointments, and whenever the students are coming, we are actually keeping all the data actually in this system. So data is actually can be different appointments, different notes. Okay, diagnosis, there are 2 ICD and DSM-5, 2 options are there. So all is actually included here. So that is actually titanium schedule. So in this software, we can use, I'm audible now? I think something stuck.
No, sir, you are audible.
Thank you. Right. So in this software, it's actually highly secure. I told you, encryption is there. Okay, it's under Center for College Mental Health. Okay, so this is a very important thing. Without titanium schedule, there is no counseling center. I can say in that way, because our job is completely based on this. And every counseling center, would have one in charge of this titanium schedule. We have an in charge here. Like that. So that counselor is specific. Actually, this job is additional. She or he has to manage titanium schedule, and we have technical staff along with that. So this is the clinical services what we are providing: individual counseling, group counseling, psychiatric services, 24/7 crisis services, medical disbursement, resource of the institute. I'm just giving you a brief individual counseling, because it's not simple individual counseling. I can say that. I told you, most of our clients, somehow 40-50% is actually have some kind of clinical symptoms. So we are actually following evidence-based psychotherapy protocol, especially psychotherapy like cognitive behavioral therapy, CBT. That can be 10 or 15 sessions, maybe minimum, or plus more sessions. Sometimes 5 sessions short also was helpful. This is actually we follow here. And I do not know any of the counseling centers in India is actually, everybody doing CBT, everybody say I'm doing CBT. I do not know whether they are actually really doing 10 or 15 or 20 or 25 sessions of CBT. I do not know seriously. In college mental health counseling, I am telling you, this is a good opportunity. We have to compete we can improve our skills, our psychotherapeutic skills in the field. Because students are already residing here, they will come for regular appointments. We can keep it proper CBT sessions. And CBT is I am giving much attention on CBT because CBT is very helpful, very understanding among students, and easy to convince them, because more than 500 plus articles, scientific articles already there. So it's very easy for them to convince. And some of the students itself, they will come to the counselors and like, sir, actually, I have depression, I need CBT. So they are already worked on because they are intellectual. Of course, you also intellectual, you're the same age group. You always search in everything in the net. So what is the first line of treatment for depression or second line of treatment? Whatever that they know very well, they are actually bringing to the counseling center. If it is an OCD, the moment they would say that I want other behavioral techniques and exposed response therapy or any other therapy techniques, because that's actually I really want on it. But generally I choose CBT first because CBT is a more educating. That itself is actually mitigating their symptoms. Symptoms is reducing after a couple of sessions. OCD also. Then if it is not working, then I will go for a more exposure therapy. But individual counseling is not simple counseling. That's what I'm saying. It's very highly evidence-based sessions. And there are a couple of sessions we go with our client-centered approaches. I mean, or humanistic perspective. Only 1 or 2, 3 sessions. It just improve their, skills like decision making, problem solving, creativity, all kind of stuff. And group counseling is also there, especially for social skill training, for social phobia, social anxiety, such kind of OCD also they have followed. And psychiatric services, if any student, those who need a psychiatric diagnosis plus, diagnostic clarity or diagnostic, formulation, definitely we are actually taking psychiatrist help just for one appointment. Sometimes we are sending, or the prominent symptoms is there, definitely we will ensure the psychiatric facility. And we have a psychiatrist. We are referring the case for psychiatrist, and psychiatrist seeing the cases. It's not necessary psychiatrist actually immediately prescribe medicines. Only if it is required, only he has to take the medicine. That is also based on the discussion with the counselor and psychologist. It's very, highly advanced case management or, mutual team working together here. And we have 24 in this crisis service, crisis intervention is anyway I have to discuss today after a couple of slides. I will discuss from there. And medical disbursement is actually, some of the students are actually staying here and they should need to get monitored because of their medicines. So we are keeping the medicines in the counseling center. And we are actually, the students, if they need a medicine, then we are actually providing from here, because sometimes the student, those who have any kind of active suicide ideations or anything like that, we cannot simply give the medicines with hand. Simply eat it and sleep. So we need to be more cautious about it. And we are actually take care about it. And on the basis of their symptoms and their suicidality, and on the basis of the risk assessment, we are actually doing that process. And resources of the institute, we have different other, jobs. Sometimes we have to help the institute if any kind of help is required. Okay. And plus teleconsultation. So this is a new system we established during this COVID-19 pandemic. Teleconsultation means they have to go a particular, send an email, so students can approach from their hometown. We have a specific Microsoft team already we installed. So all the classes as well as our counseling process is also the same. So it's highly protected. So already we have some agreement with the team, and we are working on it. And the professionals, it's already there: counselors, psychiatrists, technical support, and administrators, and liaison with hospital. So we have one hospital. Because hospital is and counseling center is separated. You know why? Why it is separated? Who will answer this? I don't have a chocolate, but just imagine you got some chocolate.
So because of the stigma associated
Yes, of course. Ask me from where? This is
Prajyoti.
Oh, that's great. And I want not only ask me, anybody can answer these questions immediately. So who will give the first answer, that person will get this kind of, what I said, that imaginative or visualized chocolate. Okay, thank you. So this is actually very important. Okay, what I said, this hospital. So hospital is separated. Only the case is actually required immediate, admission. We are actually referring to the case to hospital, and we are seeing the students from there. So doctors immediately will call to the counselors, and we are referring to the psychiatrist. So we have a lot of role here. So that's what I'm saying. All the case management is actually under this counselor. So counselor decision is actually final here, and we are actually the support for the hospital too. So this is the similarity and differences in conventional with counseling setup. I mean, conventional and both our setup. Of course, you know that in our general hospitals, how their system is actually, there any other problem. Leave it about the psychiatric problem. Follow-up may not be much there. Only the patient is thinking to follow up, they are coming back to the hospital. But doctor will and then the symptoms also will reduce. That's actually we are going to the final diagnosis in that. So this is access to, you can say that avoidant PD and borderline. This is the very highest because of this population. So this is also very interesting. And avoidant PD is actually happening because we have seen a lot of students are actually very shy and they are actually avoiding their mainstream. They wanted to keep quiet themselves. When we are actually assessing their approaching to the counseling center, somehow we understand they have these features, classic features of avoidant personality disorders. So this is actually the global assessment functioning. Here you can understand that, see among the participants, the 70 to 60, that category, that is actually moderate, functionality, social occupational or functioning, their score is actually moderately high. Those people are very high. And see about below 30, it's very zero. Why it is happening? Because it's a very serious condition. They may not be in the campus. We are referring to the care centers directly. Okay, so the numbers is actually mostly we are seeing this above 60 or above 40, most of the people. And why I'm telling you that this graph is very important because they have the symptoms. Even they have schizophrenia, but they are actually going to the classes. Okay, and their functionality somehow it is intact, but they have the features. And some of the cases actually we are asking their parents to stay in their campus, and we will provide a special academic accommodation. So parent is actually supervising their children or our students in that. Okay, so this is actually the clinical services what we are providing. Now we have to go the college-based crisis intervention in a residential college campuses in India. So what is crisis actually here? So crisis is actually nothing in a new term. Maybe you also know about crisis. Any sudden immediate psychiatric help is required. That can be hospitalization, immediate hospitalization required. Sometimes very active psychiatric symptoms remain, like acute psychosis or any kind of suicide attempts, like that, even suicide. Okay. So all we actually have seen here, all type of cases I have seen here. I was actually sometimes I also felt bad, and in some cases we have seen they actually attempted suicide. So, and we are also very expert to these warning signs of suicide and everything. Somebody says something about suicide, somehow we can predict, yeah, this something will happen now. We need to be more care about it. So, by practicing with students a long time, the warning signs, what they are actually showing up, somehow we can understand. But still, completed suicide, those who died, their number is actually still less. I mean, approaching to the counseling center. It's a very sad as a story. Those who died, most of the students, those who died, never approached the counseling center. And they may not show very active suicidal ideations or warnings, but somehow after they died, we could able to identify their warning signs by their Facebook post or their, somewhere they have written something like that. Otherwise, we cannot able to easily identify them. Sometimes I think they may have our double depression. You probably may know about double depression. What is double depression? Anybody know double depression? I don't have chocolate again. Okay. Double depression is actually the person, those who have mild depression. Even among us also, there are people out there, mild depression. Some very chronic depression will be there, chronic mild depression. But in between, there would be some kind of major depressive disorders. That's actually double depression. Such people, there is a chance to hide suicide ideations or maybe active suicide ideations. So that's why we cannot easily identify. Sometimes we think that they are actually very good and they are very active. Yeah, he was with me yesterday. Suddenly I don't know what happened. So sometimes their friends are sharing in this way. One friend is simply asking, okay, I wanted to go out. He simply go to the railway track and committing suicide. So they are also actually wondering what. Nothing happened to their life. Everything is very smooth. Why this kid is actually taking such a drastic step? Okay. So crisis intervention is actually include all these things together. So we have a 24/7 crisis duty. One counselor is actually there. It's not like he's actually sitting in a counseling center and waiting for a crisis. He will be in our house, and our numbers are actually visible in all the academic or hospital or wardens, like that. If anything happened, they immediately call to the counselor, and counselor is actually going to the hospital, and they are actually shifting the student to the hospital directly, and we are seeing the cases from there. And this is our system generally whenever we see the crisis. So my topic today, you probably know about college mental health care. One is clinical services, second is crisis intervention. So crisis intervention here actually what we follow. This is actually the specific protocol. If someone is actually simply walking to the counseling center, also sometimes can be a crisis. We will assess their mental status examination. If it is very immediate, we are referring to the on-call counselor for immediate action and recommending intake based on the risk. If it is not a very immediate thing, then we are actually seeing the following day or more on the basis of the appointment. Sometimes crisis is actually immediately transferring to the hospital, so hospital will call us and we are doing the clinical interview there. And sometimes refer other sources. Sometimes if anything happens, we have to go to the campus premises, we have to go to the campus places, we have to immediately jump in that place and do some kind of intervention if we could able to possible. So, but generally we prefer to go to the hospital, see the cases from there. So this is the safety net. What is safety net means? If someone is actually showing any kind of high suicidal ideations, we are working together. It's not only the counseling center can save their life. We have a professor in charge of counseling center. We have warden. We have Dean Students Affairs. We have other networks, security people, students coordinators are there. So we all work together. We ensure their safety net. Because here again, why it is important? Sometimes they have suicide ideation, but that is not very active. So we cannot simply putting them all time in the hospital. So based on their risk, but we actually protect at the same time this network together. So wherever they go, these people are is already on monitoring by our students or our this team. This is actually the system. Just I'm sharing one case. I think just for at least for this session, one example of crisis. A 23-year-old male second-year MTech student presented with complaints of over-talkativeness, irritability, related mood, and anger outbursts toward his wingmates. He confined himself in a room, closing all the doors and windows, and restricted his friends from entering to his room. He also switched off his mobile and deactivated all his social network accounts. He reported to the counselor that he is under surveillance and people are planning to attack him. He has been diagnosed with cannabis-induced bipolar disorder with psychotic features. So this is a crisis, and we are actually immediately jumping to the hostel, and we talked to the boy. Somehow we are admitted to the hospital. From there, this case was very serious. So we are referred to the higher centers. This is a common. I'm just telling you, not this is one incident happened in the 1 year, not like that. This is a very common. It happened here. So every day one on-call person is there. It means crisis numbers are very high. It doesn't mean that all crisis is actually suicide, complete suicide. Maybe attempted suicide will be there. Okay. So this is a very high. And our population is actually around 10,000 students. 14,000 students are studying here. It's a 2,000-acre place. So that much of students are there. So crisis is very common here. Okay. So we are crisis experts. So this is a crisis protocol. We have a safety net. If it is outpatient, we do outpatient care. After outpatient care, so counseling center, warden, and all these people are under this. Their roomie, security guard is actually under this monitoring group. If it is inpatient care, maybe in our hospital we are admitting them, or otherwise they will be in supervised care by their family members. Okay, in the institute. Maybe we also ensure 24/7 security there. So this is actually the crisis, individual crisis. Now we need to talk about group crisis. What is a group crisis? We have very less time. Who is the very smartest? What is group crisis?
I'm not sure about it, sir, but maybe something that is common among a group of students.
Okay. It's very common. That's true. Crisis that affect in a group. Yes, of course, Tango and I don't know the name. Okay, anyway. So it's actually happening. Group crisis is actually not very interesting to listen that. It's a very bad thing. Bad thing in sense it's really, we also several times we struggle with this. If any suicide happen in the campus, then this is going to be a group crisis. There are a lot of responsibilities we have once it happened. Okay, so students also they have a lot of denial, anger, and some people, students those who are already vulnerable, they have suicide ideations. They also get this kind of thoughts. It's a very high time of crisis, and some of his friends also was very disturbed. Couple of days, couple of months, couple of weeks, like that. It's actually group crisis. So we also have specific protocol. We have worked together. We actually developed. I do not know any other system in India is actually follows such system, because we only actually seeing this very common here. So we say it's post-vention after the suicide, the crisis intervention. We call it as a post-vention. So individual count. This is actually the system what we follow. We actually visit the hall. I mean, hall means hostel. So we are visiting the hostel. We are saying here it's a hall means it's a hostel actually. And we conduct one program there, one session. That session, all the students, I mean, all the group students actually, his survivors, I mean, his friends, okay, those who died. So everybody will be there. From there, we actually do one session, common session. Sometimes students also very angry towards us. Like, what are you doing here? You are a counselor, you should stop this, all kind of stuff, because that kind of anger outburst will be there. So we actually listen everything in a very calm and quiet way, standing in front of them. Then from there we found we will identify some of the students, those who are highly or those who are very close to this boy or girl. We are actually picking them. And we will conduct a focus group intervention or special session for them. And again, we actually divide that groups in an individual counseling session. Some of the students are deeply affected. So we do specific individual face-to-face session for such students. This is actually the system what we follow here. If anything happen, immediately we actually, all the counselors come together and we plan and we execute immediately all these things. It's not only for the students, even the families of this disease, I mean disease, I mean died. Also, we actually providing some kind of psychological support for the family too. So, if anything happen, find respective hall or sensitization, visit the affected rooms, roomings, etc., and collecting affected students list, focus group sessions, individual counseling. So finally, this is actually reach out. So reach out to stop suicide contagion. So what is suicide contagion? What is suicide contagion? Okay. So suicide, yeah, please.
I think it's when people are exposed to other people committing suicide, it creates a sort of distress among a group.
Yeah, the Lakshmi answered. It's a chain of suicide. Okay, it's actually if someone is actually died and then another person is also taking the same step and he's also actually died. So most of that's actually that's actually a difficult and challenging situation we actually came across before. Two occasions we actually came across like that. If any suicide happened, you know what is the specialty of suicide? They actually choose the same date, same month kind of thing. It can be in that format. Or otherwise, you know, they actually, after one thing happened, after 15 days or 30 days, second, third, fourth. One time we have found 4 suicides continuously. Okay. And another, we found 3 suicides continuously. That is actually suicide contagion. It's a kind of chain of suicide. So immediately we have to break this chain. So for that, we are actually conducting a specific program that is actually the reach out. Here, Mr. Shamsir, can you come here? So here, actually, what we are trying to say that suddenly we have to break this chain. Guys, suddenly we have to, stop this chain. So we conduct a specific, sensitization program immediately in the campus. Okay. So one time, what we have done, it's a 4 days program. We actually kept all the switched off all the lights in the walls, all the campus lights off, and we asked all the students to come to one single place, and we are actually putting some songs or like that. So just change the environment, changing the environment. Okay, and some kind of other programs also, you know, all the halls we are actually giving, and every people are students also, several specific groups are there. They were talking about suicide, prevention about suicide. This all will make someone is actually any kind of such thought, that person somehow will postpone the idea. I cannot say completely he will stop the idea, but we can at least we can break this chain. That several 2 times, not several times, because this happened 2 times. We actually somehow could break this chain and be success. After 1 or 2 years, there was no suicides. So this is actually a specific program we will do in our counselors. And we are working together with students coordinators. We have a particular students group, IWG, Institute Wellness Group, and other students wellness group, sports groups, other different communities are here. Everybody is working together. So faculties are here, deans, council is here. A group of faculty together is actually working only for mental health. So, but all is actually working under the counseling center. So this is actually my session today. So thank you. I think it's a huge, somehow I was actually made it very short because we have very less time. So I just want to finish by 11. Okay. Thank you so much. If you have any questions, you can ask.
Thank you so much, sir, for that wonderful presentation and for the invaluable knowledge you've shared. It is very thought-provoking and knowledgeable. Thank you. Now, if anyone has any questions, can you please put them in the chat box? I repeat, if anyone has any questions to ask, sir, please ask them.
I don't have any questions. Already everything is done.
Sir?
Yeah, please.
Nowadays, the stigmas are the real problem in which a person is not able to disclose their problems to others. So even despite of being a psychology student, sometimes we are also shy to explain our problems to others. So for the development of a complete well-being of the society, we have to break the stigma. So as a good psychology student or a psychologist, how can we contribute to the society to remove the stigma?
This is a very broad question. Actually, first of all, Miss Ashley, you are saying right. If us have any problem, whether we will approach any counselor or not, that's first of all we need to do this introspection among us, whether we are approaching or not approaching. If you are not approaching, what is the reasons? If you are approaching, what is the reasons? So first of all, we need to, as a psychology student itself, we need to introspect ourselves, and we need to find what are the factors actually contributing to the stigma, and we need to work on it. Why? Because your question is very broad. That's what I answered a very broad way. And you need to give more awareness. There is no other thing we have to break the stigma. We need to give more awareness, but your stigma is actually changing. For example, today you can see the Facebook, how many programs are there? Most of the campuses actually conducting programs for mental health. And some of the groups, those who are not psychology group, they are also conducting programs, inviting lecturers, people are there. So only this kind of sensitization program we have to do awareness program, then only we can able to do this kind of stigma. We have to reduce the stigma. Stigma will be there. It's not only the personal stigma, social stigma also there. What others people are thinking when I'm going to the counseling center, it will be there. But once they're entering the system, then stigma is actually somehow breaking there. That's what we have experienced among our students. When they're entering the counseling center, because if you go to a new place, what kind of thoughts are coming in your mind? First, now I came to in front of you and with a lot of thoughts. Yeah, what about the student? Whether they actually will understand in my English, whether they understand what I'm trying to say. Okay, like that. Okay, but once I entering this setup, I think students are understanding what I'm trying to say. Okay, so these kind of thoughts are there in any system. Plus, they think about the social stigma about what others people are thinking when I'm going to the counseling center. Plus personal stigma, like Is it like I'm not that much of very strong when I go to the counseling center? This both is actually happened. So we need to introspect among ourselves about stigma, and we need to again work, give the awareness the population, and also we need to say our people that whatever the information you are sharing with your counselor, it's highly confidential. This is the thing. And actually, I also wanted to share one more thing. This is actually in my college. I remember our Varghese Paul sir. He's actually said during my college years, as a counselor, we need to develop a specific skill. Like whatever any of your friends are sharing anything to you, don't actually, please keep that thing in a highly confidential. That itself is actually develop a trust among, your friends. Once it is slowly established in your group, in your circle, people will approach you. Okay.
Thank you, sir.
Yeah.
So we have another question by Anina Victor. How can we ensure mental health of students during the lockdown condition?
Okay. This is a very relevant question. You cannot ensuring mental health of students. A lot of pressure students are facing. It's not only the pressure is actually one pressure is in this age group, they are staying their home with their parents, and conflicts are very high. Family conflicts are very high because students like me also, when I am in home, what my parents will do all the time, go and study. Am I right? So the high pressure from that time, in that even the small issues, plus lot of workload, lot of completions, assignments, plus we are actually far from some of the families actually conflict is very high. Even I remember one of the student is actually reported in an anonymous forum that she's facing abuse from home. Actually, she was not there for a long time because she was in a hostel. Now she is actually bound to be in her house, and she is experiencing this abuse. So the stresses what students are facing at present is actually, we cannot say, that much. I can say what is it? The amount is very high. It's not only the students, others also. So we cannot ensure that. Only the thing is that I can say that your friends, among you guys, ask your friend, how are you doing, like that. It's only the thing we can do at present. For example, I am getting a lot of calls from Kerala and other countries. Okay, and some people are very well financial setup. They're actually calling for counseling and everything. And some of my friends also. I'm just asking, how are you doing? Simply a message. Sometimes that message is also enough for them to share, just to ventilate their emotions to you. They're sharing their problem itself is actually giving some kind of support we could able to provide. So doing all this kind of very slowly, I think that would be effective. Otherwise, we cannot do anything more. If you found anybody in a serious trouble, definitely you need to work on it. You need to report your your faculties or any doctors or their parents, like that. It's required. Thank you. That's a good question. I felt.
Because of shortage of time, we have one last question. It is by Shaija. Can you tell me the procedure for the telecommunication procedure in your campus?
Okay. Actually, our telecommunication procedure is only for bona fide IIT Kharagpur students, because currently it's not for public. What we have established, this system, we say tele-consultation services. Okay. One is actually for students, those who already attended the counseling center before, and they actually can continue their services from their hometown, from among us, plus their hometown, if any psychiatric help is required. Otherwise, students also calling first call or in a fresh intake, we are attending the call, and there are some procedure they have to go with the proper informed consent we are sending. They have to fill that and they have to send it back. All is very confidential. And they have to give all the details. We are not taking any anonymous call because it's a lot of accountability. We are actually not seeing any anonymous call. Only it's identified case with their ID proof, everything is required. We are seeing the case. We are attending them. If the case is required, any kind of immediate psychiatric evaluation is, if it is required, we are asking the person to meet the psychiatrist in the hometown. Okay, and we cannot. The thing is that that is also every problem will not solve by a teleconsultation. Telecounseling. Some of the cases, face-to-face interview is necessary. So we will give in that kind of. Some cases we are doing that. Some cases we are actually doing basic psychological support. Only counseling is required. We continue the session. So this is our system.
Thank you so much, sir, for being so passionate, for clearing our doubts. And now we present you a stencil drawing by a student from 3rd BSc Psychology, Deepika Shivanandan. We present it on the screen.
Yeah.
It is actually a stencil art drawing by Deepika Shivanandan of 3rd BSc Psychology.
Okay. You're able to see. I think. Are you sharing now?
Yes, sir. They're going to present soon. Just a minute.
Okay.
I think they're facing some technical issues. Just a minute, sir. Can you wait? Okay, they're facing some technical issue, it seems. So it's all right. We'll be moving. Thank you so much, sir, for being here with us today. It means a lot, actually. Your webinar to it was so informative, and thank you so much for your knowledge share. It means a lot. So we are going to move on to the next session.
Okay, now we're moving on to the cultural programs. First, we have a video presentation on this theme by 2nd BSc Psychology students and a talk based on it by PhD scholar Bayana.
Dr. Suganya, miss. Okay, let her present.
Sorry, sir, for the delay. It's because of some technical issues. Sir, before we move on to the next procedures, I would really love to extend my thank you to you from the side of our department, also for the webinar. It was really knowledgeable and you shared it well and being so passionate about clearing our doubts. Thank you so much, sir.
Thank you. Our faculties are there in the group. Okay, I have another session after this. Yeah, I think Sugina, Miss, are you there in the?
Yeah.
Yeah.
Brother, you can leave then. Thank you for the wonderful presentation.
Okay. Oh, please send me all these things.
Of course. Thank you. Thank you.
Yes, sir, both the drawings will be sent to you. Once again, thank you so much for gracing us with your presence.
Okay. Thank you so much. I also want to express my deep gratitude to Milu Miss for inviting me for this wonderful program. I'm so happy. I'm so proud. And I also express my special thanks to Nice Mary Miss and other faculties. I think some of our faculties already left in the institute. I know Sanjay Miss and Police sir, Odis sir, Moses sir. I remember all our teachers. I'm so happy. I really wanted to. One time I thought to come to the Thrissur and visit our campus. Somehow I couldn't able to make it up. I came to St. Aloysius College and Christ College, but somehow I couldn't come my college. But at least somehow today I could talk to you guys. I'm so happy. And I also express my special gratitude to other faculties of Prajyoti Niketan College. And Bhavya also, my batchmate was here. Bhavya, I think she left now. And Dr. Lijo is also a very smart guy, and he was my PhD batchmate. He's actually another, big shot among our group. He was my junior in Prajyoti, and again he was my big junior.
Always associate our heart with our emotionality. So what is there? What we really like, our affective preferences, unconscious motives, and
Shamsi, please unmute.
So anyway, I also express my special thanks to Suganya Miss. I could identify your your face. It's very similar. I remember your face. And also thank you all my faculty, students, and my colleagues and my friends also I think joined in this program to see my lecture. And thank you all. And can I leave now? You wanted to say something, please say. Then I will give you 2-3 minutes. Then I can leave.
No, sir, I think so many people are facing technical issues. That's why we're not able to communicate with
No problem. So I'm just leaving. Thank you all again.
Thank you so much, sir.
Bye.
Thank you.
Thank you, Abir.
Yeah.
Now we're moving on to the cultural programs. First we have a video presentation by second BSc Psychology students on the theme and a talk based on it by the PhD scholar Bayana.
Hi everyone, October 10 is mental health. ലോകത്തിന്റെ നാനാഭാഗങ്ങളിലുള്ള പലതരം മനുഷ്യർ മാനസികാരോഗ്യത്തെക്കുറിച്ചും അതിന്റെ പ്രാധാന്യത്തെക്കുറിച്ചും സംസാരിക്കുകയും അതിനുവേണ്ടി പ്രവർത്തിക്കുകയും ചെയ്യുക എന്നതാണ് ഗ്രേറ്റർ ഇൻവെസ്റ്റ്മെന്റ്. ഏതൊരു മനുഷ്യനും ലോകത്തെവിടെയും തന്റെ മാനസികാരോഗ്യ സംരക്ഷണത്തിനായി ഉപാധികൾ ഉണ്ടാവുക എന്നതാണ് ഗ്രേറ്റർ ആക്സസ്. ഒരു കാര്യം പ്രത്യേകം ശ്രദ്ധിക്കുക, മാനസിക ബുദ്ധിമുട്ട് നേരിടുമ്പോൾ വ്യാജന്മാരിൽ നിന്നോ ചൂഷകരിൽ നിന്നോ അല്ല, യോഗ്യരായ മാനസികാരോഗ്യ വിദഗ്ധരിൽ നിന്ന് സഹായം തേടുക. It's October 10, World Mental Health Day. So, let's invest, access and move for mental health.
കേൾക്കുന്നുണ്ടോ മിസ്സേ ആഷ്ലി?
യെസ് ചേച്ചി കേൾക്കാം.
ഹായ് ഫ്രണ്ട്സ്, ഇന്ന് നമ്മുടെ സ്വന്തം ദിവസമാണ് വേൾഡ് മെന്റൽ ഹെൽത്ത് ഡേ. ഇപ്പൊ നല്ലൊരു ക്ലാസ് കേട്ട് ബ്രെയിൻ സ്റ്റോമിംഗ് കഴിഞ്ഞിരിക്കുക എല്ലാവരും. നമ്മൾ 11:30 നിർത്താം എന്നുള്ളൊരു പ്ലാൻ ആയിരുന്നു. പക്ഷെ എന്തായാലും അത് കുറച്ച് പോകും, കാരണം കുറച്ച് പ്രോഗ്രാംസ് ഒക്കെ നമ്മൾ എല്ലാവരും ചെയ്തു വെച്ചിട്ടുണ്ടല്ലോ. അപ്പൊ അതൊക്കെ ഒന്ന് കാണണ്ടേ അല്ലേ? അപ്പൊ ഇപ്പൊ ഞാനിന്ന് സംസാരിക്കാൻ പോകുന്നത് നമ്മുടെ തീമിനെ കുറിച്ചാണ്. എല്ലാവരും ചർച്ച ചെയ്യപ്പെടുന്ന ഒരു വിഷയമാണ് മെന്റൽ ഹെൽത്ത് ഫോർ ഓൾ, ഗ്രേറ്റർ ഇൻവെസ്റ്റ്മെന്റ്, ഗ്രേറ്റർ ആക്സസ്, എവരിവൺ എവരിവെയർ. ഒരു പേജ് നിറച്ചുള്ള വലിയൊരു തീമാണല്ലേ ഇപ്രാവശ്യം. ഇപ്രാവശ്യത്തിന് ഒരുപാട് പ്രത്യേകതകളുണ്ട്. കാരണം ഇപ്പൊ സാർ പറഞ്ഞു കഴിഞ്ഞു, കോവിഡിന്റെ പാൻഡമിക് സിറ്റുവേഷനിൽ നമ്മളെല്ലാവരും ഏത് സിറ്റുവേഷനിലാണെന്ന് നമുക്ക് എല്ലാവർക്കും അറിയാം. അപ്പോൾ മെന്റൽ ഹെൽത്തിന്റെ കാര്യത്തിൽ വരികയാണെന്നുണ്ടെങ്കിൽ സാധാരണ WHO അതിൻ്റെതായ രീതിയിൽ അത് ഒബ്സർവ് ചെയ്യാറുണ്ട്. വേൾഡ് മെന്റൽ ഹെൽത്ത് ഫെഡറേഷൻ അവരങ്ങനെ ചെയ്യാറുണ്ട്. പക്ഷെ ഇപ്രാവശ്യം 3 ഓർഗനൈസേഷനുകൾ ക്ലബ് ചെയ്തിട്ടാണ് മെന്റൽ ഹെൽത്ത് ഡേ ആചരിക്കുന്നത്. ഒന്ന് WHO, വേൾഡ് ഹെൽത്ത് ഓർഗനൈസേഷൻ, ദെൻ അടുത്തത് യുണൈറ്റഡ് ഗ്ലോബൽ മെന്റൽ ഹെൽത്ത് എന്ന് പറഞ്ഞിട്ടുള്ള പുതിയ 2018 ലോഞ്ച് ചെയ്ത ഒരു ഓർഗനൈസേഷൻ ആണ് അവരും. പിന്നെ അതുപോലെ വേൾഡ് ഫെഡറേഷൻ ഫോർ മെന്റൽ ഹെൽത്ത്. ഈ 3 ഓർഗനൈസേഷനും കൂടെ ക്ലബ് ചെയ്തിട്ടാണ് ഇപ്രാവശ്യം പ്രോഗ്രാമുകൾ നടത്തുന്നത്. നിങ്ങൾ ഈ വാചകം ശ്രദ്ധിച്ചോ? നമ്മുടെ തീമിന്റെ മെന്റൽ ഹെൽത്ത് ഫോർ ഓൾ, അതെല്ലാവർക്കും മനസ്സിലായിട്ടുണ്ടാവും. ഗ്രേറ്റർ ഇൻവെസ്റ്റ്മെന്റ്. ഇൻവെസ്റ്റ്മെന്റ് എന്ന വാക്ക് എന്തുകൊണ്ട് എടുത്തു എന്നുള്ളത് നമ്മൾ ആലോചിക്കണം. ഇൻവെസ്റ്റ്മെന്റ് എന്ന് പറയുന്നത് പലപ്പോഴും ബിസിനസ്സിലൊക്കെ ഉപയോഗിക്കുന്ന ഒരു വാക്കാണ്. അതായത് നമ്മൾ എന്തെങ്കിലും നിക്ഷേപിച്ചാൽ അതിൽ നിന്ന് പിന്നീട് ലാഭം കൊയ്യുക, അല്ലെങ്കിൽ നിക്ഷേപിച്ചതിനേക്കാൾ കൂടുതൽ കിട്ടുക എന്നൊക്കെയുള്ള ഉദ്ദേശത്തോടെ ഉപയോഗിക്കുന്ന ഒരു പദപ്രയോഗമാണ് ഇൻവെസ്റ്റ്മെന്റ്. മെന്റൽ ഹെൽത്തിന്റെ കാര്യത്തിൽ ഇപ്രാവശ്യം അതാണ് സ്വീകരിച്ചിട്ടുള്ളത്. അതൊരുപാട് ആഴത്തിൽ അർത്ഥമുള്ള ഒരു വാക്കാണ്. അപ്പൊ ഇൻവെസ്റ്റ്മെന്റ് എന്ന വാക്ക് നമ്മളിപ്പോ ആലോചിച്ച് നോക്കൂ, ഒരുപാട് സ്ഥലങ്ങളിൽ എത്രത്തോളം മാനസിക കരുത്തിന് ആളുകൾ മുൻഗണന നൽകുന്നുണ്ട് എന്നുള്ള കാര്യം. ലോക രാജ്യങ്ങളുടെ കണക്കെടുത്താൽ വെറും 2% മാത്രമാണ് മാനസികാരോഗ്യത്തിന്റെ കാര്യത്തിന് വേണ്ടിയിട്ട് ഓരോ രാജ്യങ്ങളും ഇൻവെസ്റ്റ് ചെയ്യുന്നത് എന്നാണ് സ്റ്റാറ്റിസ്റ്റിക്സ് പറയുന്നത്. നമ്മുടെ രാജ്യത്തിന്റെ കണക്കെടുത്ത് നോക്കാം. ഇപ്പൊ നമ്മുടെ രാജ്യത്ത് തന്നെ പല സംസ്ഥാനങ്ങളിലൂടെ നടന്നു നോക്കിയാൽ നമുക്കറിയാം മെന്റൽ ഹെൽത്തിന്റെ കാര്യം എന്താണെന്ന്. ഫിസിക്കൽ ഹെൽത്ത് പോലും അടിച്ചമർത്തപ്പെട്ട് കിടക്കുന്ന ഒരു സ്ഥലങ്ങളില് മെന്റൽ ഹെൽത്തിന്റെ കാര്യം ചർച്ച ചെയ്യപ്പെടാൻ എത്തുമോ എന്നുള്ളത് തന്നെ നമുക്ക് ഇപ്പോൾ ശരിക്കും പറഞ്ഞാൽ ആശങ്കയാണ്. അപ്പൊ ഫിസിക്കൽ ഹെൽത്തിന്റെ കാര്യം തന്നെ നിങ്ങൾ നോക്കൂ. ശരിക്കും ഒരു ഫിസിക്കൽ ഹെൽത്ത് നഷ്ടപ്പെടുന്ന സമയത്ത് അയാളുടെ ഫിസിക്കൽ ഹെൽത്ത് മാത്രമാണോ നഷ്ടപ്പെടുന്നത്? അല്ല, അയാളുടെ മെന്റൽ ഹെൽത്തും കൂടെ അവിടെ ഒരുപാട് ടോർച്ചർ ചെയ്യപ്പെടുന്നുണ്ട്. ഇന്നത്തെ സാഹചര്യത്തിൽ എന്ന് പറഞ്ഞാൽ ഇപ്പൊ നമ്മൾ ഈ പാൻഡമിക്കിന്റെ സമയം ഒക്കെ ആയിട്ട് തന്നെ ഓൺലൈനിലൂടെ ഒരുപാട് ചർച്ചകൾ വന്നിട്ടുണ്ട്. ഓൺലൈൻ കോഴ്സുകൾ, പാൻഡമിക് ഇൻ മെന്റൽ ഹെൽത്ത് എന്നൊക്കെ പറഞ്ഞിട്ട് കോഴ്സറ, അതുപോലെ ഫ്യൂച്ചർ ലേൺ, അതുപോലെ ഒരുപാട് കോഴ്സുകൾ മെന്റൽ ഹെൽത്ത് റിലേറ്റഡ് ആയിട്ടൊക്കെ ചെയ്യാൻ വേണ്ടിയിട്ടൊക്കെ വന്നിട്ടുണ്ട്. ആളുകൾ സംസാരിക്കുന്നുണ്ട്. മാത്രമല്ല, ഈ സംസാരം മാത്രം മതിയോ നമുക്ക്? അതും ഒരു കണക്കിന് ഇൻവെസ്റ്റ്മെന്റ് ആണ്. പക്ഷെ അതിനുവേണ്ടി പ്രവർത്തിക്കുക എന്നുള്ളതും കൂടെ വലിയൊരു ഇൻവെസ്റ്റ്മെന്റ് ആണ്. ഇപ്പൊ നമുക്ക് കേരള മോഡൽ വേണമെങ്കിൽ പറയാം. ഇപ്പൊ നമ്മൾ പാൻഡമിക് സിറ്റുവേഷനിൽ ദിശയുടെ ഹെൽപ്പ് ലൈൻ നമ്പറിൽ ഇഷ്ടംപോലെ 5 lakh above കേസുകളാണ് കൗൺസിലിങ്ങിനൊക്കെ ആയിട്ട് വന്നിട്ടുള്ളത്. അതുപോലെ കുട്ടികൾക്ക് വേണ്ടിയിട്ട് ചിരി എന്ന് പറയുന്ന ഒരു പദ്ധതിയൊക്കെ കൊണ്ടുവന്നു. അതൊക്കെ മെന്റൽ ഹെൽത്ത് കെയറിന്റെ ഭാഗമായിട്ടും അതിന്റെ ഒരു ഇൻവെസ്റ്റ്മെന്റിന്റെ ഒക്കെ ഭാഗമായിട്ടാണ് നമുക്ക് അതിനെ കാണാൻ പറ്റുക. ഓക്കെ, എന്നാൽ എല്ലായിടത്തും ഇതാണോ? അല്ല. പക്ഷേ നമ്മൾക്ക് എന്ത് പറയാൻ പറ്റണം? മാനസിക ആരോഗ്യം വേണ്ട ആളുകൾക്ക് അതിനുള്ള കരുത്ത് അല്ലെങ്കിൽ അതിനുള്ള സേവനങ്ങൾ എല്ലാവർക്കും ലഭ്യമാണ് എന്ന് ലോകത്തോട് വിളിച്ചു പറയാൻ പറ്റുന്ന ഒരു അവസ്ഥ വരണം. ആ അവസ്ഥ വരുമ്പോഴാണ് നല്ലൊരു ഗ്രേറ്റ് ആക്സസ് എന്ന് പറയാൻ പറ്റുള്ളൂ. അപ്പോൾ ഏറ്റവും അടുത്ത് പറയാൻ പറ്റുന്ന ഹതാസസിൽ നടന്ന നമ്മുടെ UP-യിൽ നടന്ന ഒരു സംഭവം നിങ്ങൾ ആലോചിച്ച് നോക്കൂ. അവിടെ എന്താണ് നടന്നിട്ടുള്ളത് എന്നുള്ളത്? വിവേചനങ്ങൾ നടക്കുന്നു അല്ലെ. വിവേചനങ്ങൾ നടക്കുക എന്ന് പറയുന്നതാണ് മനുഷ്യർക്കിടയിൽ പലതരത്തിലുള്ള ഭിന്നിപ്പുകൾ, അല്ലെങ്കിൽ ഒരു മനുഷ്യൻ മറ്റൊരു മനുഷ്യനെ കാണുന്ന സമയത്ത് നീ മാറി നിൽക്കുക എന്ന് പറഞ്ഞിട്ടുള്ള ആ ഒരു അകൽച്ച. അവിടെ വരുന്നത് ഒരു ഫിസിക്കൽ ഡിസ്റ്റൻസിങ് മാത്രമാണോ? അയാളുടെ മനസ്സിനെ എത്രത്തോളം അത് മുറിവേൽപ്പിക്കുന്നു. അതുപോലെ പല രീതിയിലുള്ള കാര്യങ്ങൾ നമ്മൾ പാൻഡമിക് സിറ്റുവേഷനിലൊക്കെ നമ്മൾ പലരും പറയും, അല്ലെങ്കിൽ നമ്മൾ വിചാരിക്കും എന്താ കുഴപ്പമാണ്, കുറെയൊക്കെ അങ്ങ് അഡ്ജസ്റ്റ് ചെയ്ത് പോകാൻ പറ്റുന്നുണ്ടല്ലോ എന്നൊക്കെ അല്ലെ. നമ്മൾ കുറെയൊക്കെ സേഫ് സോണിലാണ് ഇരിക്കുന്നത്. നമുക്ക് നഷ്ടമുള്ളത് എന്തൊക്കെയാണ്? നമ്മൾ ഇഷ്ടപ്പെട്ട സ്ഥലങ്ങൾ, നമുക്ക് പ്രിയപ്പെട്ട ആളുകൾ, പ്രിയപ്പെട്ട യാത്രകൾ, ഇതൊക്കെയാണ് നമുക്ക് നഷ്ടപ്പെട്ടിട്ടുള്ളത്. അതൊട്ടും കുറവല്ല, അതെല്ലാം നമുക്ക് വേണ്ടത് തന്നെയാണ്. നമ്മുടെ കണ്ണിലെ കരടാണല്ലോ നമുക്ക് വലുത്. പക്ഷേ ഇതിനൊക്കെ അപ്പുറം ഒരു നേരത്തെ ഭക്ഷണം പോലും കിട്ടാണ്ട് ഞെങ്ങി ഞെരുങ്ങി ജീവിക്കുന്ന ആളുകളെ സംബന്ധിച്ചിടത്തോളം ഇത്തരം വിവേചനങ്ങളും ഇത്തരം ഡിസ്ക്രിമിനേഷൻസും ഒക്കെയുള്ള ഒരുപാട് തഴയപ്പെടലുകൾ അനുഭവിക്കുന്ന പീഡിതരായ ജനങ്ങളുടെ ഭക്ഷണം പോലും കിട്ടാത്ത ആളുകളെ സംബന്ധിച്ചിടത്തോളം ഇങ്ങനെ ഒരു പാൻഡമിക് വന്നു എന്ന് പറയുന്നത് ഇതിനേക്കാളും എന്താ പറയാ രീതിയിൽ എണ്ണ ഒഴിച്ച അവസ്ഥ, അല്ലെങ്കിൽ പിന്നെ ഒരുപാട് ദുരിതത്തിലേക്ക് പോയ ഒരു സിറ്റുവേഷൻ ആണുള്ളത്. അപ്പൊ ഇത്തരത്തിലുള്ള ആളുകൾക്കൊക്കെ മെന്റൽ ഹെൽത്ത് കെയർ കിട്ടണം എന്നുണ്ടെങ്കിൽ അവരിലേക്ക് ഇറങ്ങി ചെല്ലുകയും അവരെയും കൂടെ മനസ്സിലാക്കുകയും ചെയ്യണം. അപ്പൊ നമ്മൾ എഡ്യൂക്കേഷൻ സമ്പാദിക്കുന്നുണ്ട്, അതിലൂടെ നമ്മൾ എന്താണ് ഉദ്ദേശിക്കേണ്ടത്? ഇത്തരം ഡിസ്ക്രിമിനേഷനുകൾക്കെതിരെ നമ്മുടെ മനസ്സിലുള്ള ആർക്കാ പാരമ്പര്യമായിട്ട് നമ്മുടെ ഉള്ളിൽ ഒരു കറ വന്നിട്ടുണ്ടാകും. പക്ഷെ അതിൽ നിന്നും പുറത്ത് ചാടിയിട്ട് മാറി ചിന്തിക്കാൻ, അല്ലെങ്കിൽ ഒരു പിന്നോക്കം നിൽക്കുന്ന ഒരാളാണെങ്കിൽ അയാളെ മുന്നിലേക്ക് കൊണ്ടുവരിക, അല്ലാതെ അയാള് നീ പിന്നോക്കം നിൽക്കുന്ന ആളാണെന്ന് പറഞ്ഞിട്ട് അയാളെ വേർതിരിച്ച് കാണിക്കല്ലേ വേണ്ടത്. നമ്മളൊരു ദാനം ചെയ്യുകയാണെങ്കിൽ അയാൾക്ക് ഞാൻ നിനക്കൊന്ന് ദാനം തന്നില്ലേ എന്ന് പറയുന്നതല്ലല്ലോ അതിന്റെ ഭംഗി, അല്ലല്ലോ. ഇപ്പൊ നമ്മൾ കൗൺസിലിംഗ് സിറ്റുവേഷനിൽ നമ്മൾ ഒരു എത്തിക്സ് കീപ്പ് ചെയ്യാൻ വേണ്ടി പറയും. കൗൺസിലിംഗ് ചെയ്ത ആളെ പിന്നീട് കാണുമ്പോൾ എന്റെ അടുത്ത് വന്നിട്ട് നിനക്കൊക്കെ മാറിയില്ലേ എന്ന് പറയാൻ പാടുണ്ടോ? ഇല്ല. അപ്പൊ അതുപോലെ നമ്മൾ അവരെ ചേർത്ത് നിർത്തുക എന്നല്ലാണ്ട് അവരെ ഒഴിവാക്കി കളയുക, അല്ലെങ്കിൽ അവരുടെ ആ ഒരു പിന്നെ ഡിഫറെന്റ് ആയിട്ടുള്ള അവരുടെ ഒരു കസ്റ്റം അല്ലെങ്കിൽ ഒരു സിസ്റ്റത്തെ അതൊരു ഡിസ്ക്രിമിനേഷൻ ആയിട്ട് കാണുക ചെയ്യാൻ പാടില്ല. അപ്പൊ അത് നമ്മളുടെ ഈ ഒരു എഡ്യൂക്കേഷനിലൂടെയൊക്കെ നമ്മൾ അത് സ്വാംശീകരിച്ചെടുക്കാനാണ് ശ്രദ്ധിക്കേണ്ടത്. അപ്പൊ വേൾഡ് ഹെൽത്ത് ഓർഗനൈസേഷന്റെ ഡയറക്ടർ ജനറൽ ഡോക്ടർ TA ഗബ്രിയസസ് അദ്ദേഹം പറയുന്നത് എന്താന്ന് വെച്ചാല്, ചരിത്രപരമായിട്ട് മെന്റൽ ഹെൽത്ത് എന്ന് പറഞ്ഞാൽ അതിനെ നെഗ്ലക്ട് ചെയ്തുകൊണ്ടിരിക്കുകയാണ്. അതിനെ റീഅഡ്രസ് ചെയ്യാൻ വേണ്ടിയിട്ടാണ് നമ്മളിപ്പോൾ ശ്രമിക്കുന്നത്. 1948 മുതലാണ് പിന്നെ മെന്റൽ ഹെൽത്ത് ഡേ ആചരിച്ചു തുടങ്ങിയിട്ടുള്ളത്. ഏകദേശം 30 വർഷത്തോളായി. അദ്ദേഹം പറയുന്നത് എന്താന്ന് വെച്ചാല്, ഈ 30 വർഷവും നമ്മൾ സംസാരിക്കുക തന്നെയായിരുന്നു മെന്റൽ ഹെൽത്ത് മെന്റൽ ഹെൽത്ത് മെന്റൽ ഹെൽത്ത്. നമ്മൾ ഇതിനെ കുറിച്ച് പറയുന്നതാണ്. ഇനി പറച്ചിൽ പോരാ, ഇനി വേണ്ടത് പ്രവർത്തികളാണ്. ആ മൂവ്മെന്റിൽ ലെറ്റ്സ് മൂവ് ലെറ്റ്സ് മൂവ് ലെറ്റ്സ് മൂവ്, അതാണ് ഇപ്പോഴത്തെ മോട്ടോ. അതിനുവേണ്ടി പ്രവർത്തിക്കണം എന്ന് തന്നെയാണ് വേൾഡ് ഹെൽത്ത് ഓർഗനൈസേഷൻ മറ്റെല്ലാ സംഘടനകളും മുന്നോട്ട് വെക്കുന്ന ഒരു വാക്യം. അപ്പൊ ഇനി ഞാൻ പറയാൻ പോകുന്നത് സമ്മറൈസ് ചെയ്ത് കൊണ്ടുവരാണ്, കാരണം സമയം നമുക്ക് വളരെ പരിമിതമാണ്. അപ്പൊ ജസ്റ്റ് 3 കാര്യങ്ങളും കൂടെ പറയാണ്. ഞാൻ പറഞ്ഞു 3 സംഘടനകൾ കൂടി ചേർന്നിട്ടാണ് ഇപ്രാവശ്യം മെന്റൽ ഹെൽത്ത് ഡേ ആചരിക്കുന്നത്. അതിലൊന്ന് WHO ആണ്. അപ്പൊ WHO ഇപ്രാവശ്യം എന്തൊക്കെ കാര്യങ്ങൾ ചെയ്യുന്നു എന്നുള്ളത് ഞാൻ ഒന്ന് പറയാണ്. അതിൽ ഏറ്റവും ബെസ്റ്റ് ആയിട്ട് പറയാൻ പറ്റുന്നത് എന്ന് പറഞ്ഞാൽ WHO അവരുടെ ചരിത്രത്തിൽ തന്നെ ആദ്യമായിട്ട് അതായത് മെന്റൽ ഹെൽത്ത് ഡേക്ക് വേണ്ടിയിട്ട് ഒരു ബിഗ് ഇവന്റ് തന്നെയാണ് ഇപ്രാവശ്യം സംഘടിപ്പിക്കുന്നത്. അവർ ചെയ്യുന്ന കാര്യം എന്താണെന്ന് വെച്ചാല്, പിന്നെ ഇതുവരെ തുറക്കാൻ വേണ്ടിയിട്ട് ലോക രാജ്യങ്ങളിൽ എന്തൊക്കെ ചെയ്തു എന്നുള്ളതിനെ കുറിച്ചിട്ടുള്ള ഒരു വെബ് ഷോക്കേസിംഗ് എന്ന് വേണമെങ്കിൽ പറയാം, ഇന്ന് നടക്കുന്നുണ്ട്. അതായത് എന്തൊക്കെ ചെയ്തു, ഓരോ രാഷ്ട്രങ്ങളും അവരുടെ പിന്നെ വോളണ്ടിയേഴ്സ് എന്തൊക്കെ പ്രവർത്തനങ്ങളാണ് ചെയ്തത് എന്ന് പൊതുജനത്തിന് മുമ്പിൽ കാണിക്കുന്ന ഒരു പ്രോഗ്രാം. അതുപോലെ മദ്യം, മയക്കുമരുന്ന് പോലുള്ള ഒരാളുടെ മാനസികാരോഗ്യത്തെ ബാധിക്കുന്നു എന്നതിനെ കുറിച്ചുള്ള ചർച്ചകളും അതിന്റെ ഭവിഷ്യത്തുകളെ കുറിച്ചൊക്കെ തുറന്നു കാണിക്കലും ഒക്കെ അത്തരം പ്രോഗ്രാമുകൾ. പിന്നെയുള്ള കാര്യം എന്ന് പറഞ്ഞാല് എക്സ്പേർട്ടുകളെ കൊണ്ടുള്ള ടോക്കുകൾ. എക്സ്പേർട്ട് ടോക്ക് എന്ന് പറയുന്നത് മെന്റൽ ഹെൽത്ത് പ്രൊഫഷണലിൽ നിന്ന് മാത്രമല്ല, മ്യൂസീഷ്യൻസ്, അതുപോലെ സ്പോർട്സ് പേഴ്സൺസ്, വിമൻ പേഴ്സൺസ്, ഇങ്ങനെയുള്ള ആളുകളെ. നമുക്കറിയാം 2020 എന്ന് പറയുന്ന ഇയർ അറിയപ്പെടുന്നത് തന്നെ ഇയർ ഓഫ് നഴ്സസ് ആൻഡ് മിഡ് വൈഫ്സ് എന്നാണ്. അപ്പോൾ സ്ത്രീകളെ കുറിച്ചും സ്ത്രീകളുടെ അനുഭവങ്ങളെ കുറിച്ചും ഒക്കെ എക്സ്പേർട്ട് ടോക്കുകൾക്ക് വേണ്ടിയിട്ട് അവരൊരു അവസരം കൊടുക്കുന്നുണ്ട്. പിന്നെ ഏറ്റവും നോട്ടബിൾ ആയിട്ടുള്ള ഒരു കാര്യം നിങ്ങൾ ശ്രദ്ധിച്ചോന്നറിയില്ല, നമ്മുടെ ഈ ലോക്ക്ഡൌൺ കാലഘട്ടത്തിൽ ഒരു ഫിലിം ഫെസ്റ്റിവൽ ലോഞ്ച് ചെയ്യപ്പെട്ടു. അത് WHO ലോഞ്ച് ചെയ്തതാണ്. അതെന്താണെന്ന് വെച്ചാൽ ഹെൽത്ത് ഫോർ ഓൾ എന്ന ഫിലിം ഫെസ്റ്റിവൽ, ഹെൽത്ത് ഫോർ ഓൾ ഫിലിം ഫെസ്റ്റിവൽ. അപ്പൊ ഇത് ആദ്യമായിട്ടാണ് ലോഞ്ച് ചെയ്തത്. ഇപ്പൊ March 12 ലോഞ്ച്, അതിന്റെ ഫസ്റ്റ് പ്രോഗ്രാം സെറിമണി ഉണ്ടായിരുന്നത്. അപ്പൊ അതിൽ 4 പിന്നെ ഫിലിമുകൾക്ക് അവാർഡ് കൊടുക്കുക ചെയ്തു. പക്ഷെ അതിൽ ഏറ്റവും രസകരമായ നമുക്ക് ഇൻട്രസ്റ്റിംഗ് ഒരു കാര്യം എന്താണെന്ന് വെച്ചാൽ, ഇന്ന് WHO ഒരു അവാർഡും കൂടെ WHO കൊടുക്കാൻ പോകുന്നുണ്ട്. അതെന്താന്ന് വെച്ചാൽ ഏറ്റവും നല്ല മെന്റൽ ഹെൽത്ത് ഫിലിമിനുള്ള അവാർഡാണ്. അത് ആർക്കാ കിട്ടുന്നത് നമുക്ക് ഇന്നറിയാം. ഇന്ന് മെന്റൽ ഹെൽത്ത് ഡേ അന്നാണ് അവരത് കൊടുക്കാൻ പോകുന്നത്. അപ്പൊ ഇങ്ങനെയൊക്കെയുള്ള വാർത്തകൾ, കാരണം സിനിമ എന്ന് പറയുന്നത് ഒരാളെ ചിന്തിപ്പിക്കാനും ചിരിപ്പിക്കാനും കരയിപ്പിക്കാനും ഒക്കെ കഴിവുള്ള ഒരു മാധ്യമമാണ്. അപ്പൊ അത്തരം മാധ്യമങ്ങളിലൂടെ നമ്മുടെ സോഷ്യലി റെലവെന്റ് ആയിട്ടുള്ള കാര്യങ്ങൾ പുറത്ത് ചർച്ച ചെയ്യപ്പെടുമ്പോൾ അത് ആളുകളിലേക്ക് എത്താൻ ഒരുപാട് സഹായിക്കും. അപ്പൊ അതുകൊണ്ട് ഇത്തരം പ്രവർത്തനങ്ങളാണ് WHO ഇപ്രാവശ്യം ഇതിനു വേണ്ടി ചെയ്യുന്നത്. ദെൻ അടുത്തത് പറയുകയാണെങ്കിൽ വേൾഡ് ഫെഡറേഷൻ ഫോർ മെന്റൽ ഹെൽത്ത്. WHO പോലെ തന്നെ പഴക്കം ചെന്ന ഒരു സംഘടന തന്നെയാണ് വേൾഡ് ഫെഡറേഷൻ ഫോർ മെന്റൽ ഹെൽത്ത്. മെന്റൽ ഹെൽത്ത് ഡേ ആദ്യമായിട്ട് ആചരിച്ച് തുടങ്ങിയതും അവർ തന്നെയാണ്. പിന്നെ നമ്മുടെ മെന്റൽ ഹെൽത്ത് ഫോർ ഓൾ ഗ്രേറ്റർ ഇൻവെസ്റ്റ്മെന്റ് ഗ്രേറ്റർ ആക്സസ് എന്ന ആ ഒരു തീം ഇൻട്രൊഡ്യൂസ് ചെയ്യുന്നത് വേൾഡ് ഫെഡറേഷൻ ഫോർ മെന്റൽ ഹെൽത്ത് ആണ്. അപ്പൊ അവർ ഏകദേശം എനിക്ക് തോന്നുന്നു സെപ്റ്റംബർ 1 മുതൽ 45 ദിവസം നീളുന്ന ഒരു ക്യാമ്പയിനിങ് ആണ് അവർ ചെയ്യുന്നത്. അതോടൊപ്പം കൂടാണ്ട് ഓൺലൈൻ ഡിസ്കഷനുകൾ, അതുപോലെ ആർട്ട് എക്സിബിഷൻസ്, ഇത്തരം കാര്യങ്ങളിലൊക്കെ വേൾഡ് ഫെഡറേഷൻ ഫോർ മെന്റൽ ഹെൽത്ത് എൻഗേജ്ഡ് ആവുന്നുണ്ട്. പിന്നെ ഒരു ചെറിയൊരു കാര്യം പറയാം, ഇപ്പൊ ഒരു ഗ്രീൻ റിബൺ നിങ്ങൾ കണ്ടിരുന്നോ? പലരും കണ്ടിട്ടുണ്ടാകും. നമുക്കൊരു ഗ്രീൻ റിബൺ 4-5 കാര്യമൊക്കെ ആയിട്ട്. അപ്പൊ ആ ഗ്രീൻ റിബൺ എന്ന് പറയുന്നത് ഇവർ ഇൻട്രൊഡ്യൂസ് ചെയ്തതാണ്. അപ്പൊ ഗ്രീൻ റിബൺ ക്യാമ്പയിൻ എന്നൊക്കെ പറഞ്ഞിട്ട്, അത് മലേഷ്യയിലെ രാജാവിന്റെ മകളാണ് അതിന്റെ ഒരു പാറ്റേൺ ആയിട്ടൊക്കെ വർക്ക് ചെയ്യുന്നത്. അപ്പോൾ അങ്ങനെയുള്ള പ്രവർത്തനങ്ങളാണ് വേൾഡ് ഫെഡറേഷൻ ഫോർ മെന്റൽ ഹെൽത്ത് ചെയ്യുന്നത്. പിന്നെ അവര് ചില 5 പ്രത്യേക മൂവ്മെന്റ്സ് മുന്നോട്ട് വെക്കുന്നുണ്ട്. അതിൽ ഏറ്റവും ഫസ്റ്റ് പറയുന്ന കാര്യം എന്ന് പറഞ്ഞാൽ റേസിസം എവിടെയുണ്ടോ അതിനെ ഐഡന്റിഫൈ ചെയ്യുക, റെക്കഗ്നൈസ് ചെയ്യുക, അതിനെതിരെ റെസ്പോണ്ട് ചെയ്യുക. ഏത് തരത്തിലാണെങ്കിലും വേണ്ട അതിനെതിരെ റെസ്പോണ്ട് ചെയ്യണം എന്നുള്ളത് നമ്മൾ പത്രങ്ങളിലൊക്കെ വായിക്കുന്നുണ്ട് ഇഷ്ടം പോലെ കാര്യങ്ങൾ. അപ്പൊ അതൊക്കെ കണക്ട് ചെയ്തൊന്ന് ചിന്തിക്കുക കേട്ടോ. ദെൻ 5 ഞാൻ എണ്ണി പറയുന്നില്ല. അപ്പൊ അതിൽ ഫസ്റ്റ് മെയിൻ സാധനം പറയാണ്. പിന്നെ പറയുന്ന കാര്യങ്ങൾ എന്ന് പറഞ്ഞാൽ നമ്മുടെ മെന്റൽ ഹെൽത്തിന് വേണ്ടിയിട്ട് സ്റ്റിമുലേറ്റ് ചെയ്യുക, അതിനുവേണ്ടി അച്ചീവ് ചെയ്യുക, അതിനുവേണ്ടി വർക്കുകൾ ചെയ്യുക എന്നൊക്കെയുള്ള കാര്യങ്ങളാണ്. ദെൻ അടുത്തതാണ് യുണൈറ്റഡ് ഗ്ലോബൽ മെന്റൽ ഹെൽത്ത്, യുണൈറ്റഡ് ഫോർ ഗ്ലോബൽ മെന്റൽ ഹെൽത്ത്. ആ ഓർഗനൈസേഷൻ എന്ന് പറഞ്ഞാൽ വളരെ പുതിയൊരു ഓർഗനൈസേഷൻ ആണ്. ഞാൻ പറഞ്ഞ നേരത്തെ 2018 അവർ ലോഞ്ച് ചെയ്തിട്ടുള്ളത്. 2 ഇയർ എക്സ്പീരിയൻസ് ആണ് അവർക്കുള്ളത്. പക്ഷേ മെന്റൽ ഹെൽത്തിന്റെ കാര്യത്തിൽ ഇത്ര അധികം വളരെ നല്ല പ്രവർത്തനങ്ങളാണ് അവർ മുന്നോട്ട് വെച്ചിട്ടുള്ളത്. ഇപ്രാവശ്യം വളരെ ഒരുപാട് കാര്യങ്ങൾ പ്രവർത്തനങ്ങൾ വന്നിട്ടുണ്ട്. വളരെ ചെറിയ പ്രായത്തിൽ തന്നെ WHO ആയിട്ട് സിങ്ക് ചെയ്ത് വേൾഡ് ഫെഡറേഷൻ ഫോർ മെന്റൽ ഹെൽത്ത് ഒക്കെ ആയിട്ട് സിങ്ക് ചെയ്ത് ഒരുപാട് വർക്കുകൾ ചെയ്യാൻ അവർ മുന്നോട്ട് വന്നു എന്നുള്ളത് തന്നെ വലിയ അപ്രിസിയേഷൻ ആണ്. അപ്പൊ അവരുടെ ഒരു തീം, അവരുടെ ഒരു കൺസെപ്റ്റ് ആയിരുന്നു എന്ത്? മെന്റൽ ഹെൽത്ത് ഫോർ ഓൾ എവരിവൺ എവരിവെയർ എന്നുള്ളത്. അതായത് ലോകത്ത് എവിടെയുള്ള ആളുകൾക്കും മാനസിക ബുദ്ധിമുട്ട് അനുഭവപ്പെടുന്നുണ്ടെങ്കിൽ അവർക്ക് അതിനുള്ള ആക്സസ് ഉണ്ട് എന്ന് ഉറക്കെ തന്നെ പറയണം എന്ന് ശബ്ദം ഉയർത്താൻ ധൈര്യം കാണിച്ചു വന്ന ഒരു ടീമാണ് അവരെന്ന് പറയുന്നത്. അപ്പൊ അവരുടെ ഒരു പ്രോഗ്രാം എന്ന് പറഞ്ഞാൽ ഇന്നലെ ഒക്ടോബർ 9 24 hour ആയിട്ട് ഓൺലൈൻ വെബിനാർ നടന്നിരുന്നു. FB-ലൊക്കെ ഉണ്ടായിരുന്നു. FB-ലൊക്കെ ഞാൻ ഷെയർ ചെയ്തിട്ടുണ്ടായിരുന്നു. ആരൊക്കെ കണ്ടു എന്ന് എനിക്കറിയില്ല. അതിലെന്താന്ന് വെച്ചാൽ എക്സ്പെർട്ടിന്റെ ടോക്കുകളാണ്. എക്സ്പേർട്സ് സംസാരിക്കുന്നു. പിന്നെ അതുപോലെ മെന്റൽ ട്രോമകൾ ഓവർകം ചെയ്ത ആളുകൾ എങ്ങനെ അതിനെ ഓവർകം ചെയ്തു എന്നൊക്കെയുള്ള എക്സ്പീരിയൻസ് ഷെയറിങ്, അതുപോലെ സ്ട്രെസ് എന്താണ്, ഓരോ മെന്റൽ ഇൽനെസ് എന്ന് പറഞ്ഞാൽ എത്രത്തോളം ബുദ്ധിമുട്ട്, അതിന്റെ റിയാലിറ്റി എന്താണ്. അപ്പൊ അനുഭവിച്ച ആള് പറയുമ്പോഴാണല്ലോ എങ്ങനെയൊക്കെ പറഞ്ഞാലും നമ്മൾ എന്തൊക്കെ മറ്റുള്ളവരെ കുറിച്ച് അങ്ങനെ ഇങ്ങനെ എന്ന് പറഞ്ഞാലും നമ്മുടെ ഒരു അവസ്ഥയിലേക്ക് എത്തുമ്പോൾ അത് പടിവാതിൽ എത്തുന്നവരെ നമ്മൾക്ക് ഇതിന് ചർച്ച ചെയ്യാനുള്ള ഒരു വിഷയമായിരിക്കും എന്ത് കാര്യം. പക്ഷെ അവിടെ അടുത്തെത്തുമ്പോഴാണ് നമ്മൾ റെസ്പോണ്ട് ചെയ്യുള്ളൂ ഇറങ്ങിയിട്ട്. അപ്പൊ അതുപോലെ തന്നെ അനുഭവത്തിന്റെ കുറെ വെളിച്ചത്തിലുള്ള എക്സ്പേർട്ട് ടോക്കുകൾ ഉണ്ടായിരുന്നു. പിന്നെ അതൊരു നോട്ടബിൾ കാര്യം എന്ന് പറഞ്ഞാൽ അതും മെന്റൽ ഹെൽത്തിന്റെ കാര്യത്തിൽ ലോകത്തെ ആദ്യത്തെ ഫസ്റ്റ് വിർച്വൽ മാർച്ച് എന്നാണ് അവരതിന് പേരിട്ടിരുന്നത്. ഓക്കെ, 24 hour വിർച്വൽ മാർച്ച്. ലോകത്തിന്റെ പല ഭാഗത്തുനിന്നുള്ള ആളുകളെ ജോയിൻ ചെയ്യുക, അവർക്ക് വേണ്ട കാര്യങ്ങൾ സംസാരിക്കുക, ആ ഒരു കണ്ടിന്യൂറ്റി. അപ്പൊ അത് വളരെ നല്ല രസകരമായിട്ടുള്ള ഒരു ടോക്കായിരുന്നു. അപ്പൊ ഇതിൽ കൂടെ ഒക്കെ കൊണ്ടുവരുന്നത് സ്റ്റിഗ്മ, മെന്റൽ ഹെൽത്ത് സ്റ്റിഗ്മയെ പൊളിച്ചെഴുതുക എന്നുള്ളതാണ്. മെന്റൽ ഹെൽത്ത് സ്റ്റിഗ്മയുടെ ഒരു കാര്യം പറയുമ്പോഴാണ് ഇന്നും മെന്റൽ ഹെൽത്ത് മാനസികത്തിന് എന്തെങ്കിലും അല്ലെങ്കിൽ മാനസികമായിട്ട് ബുദ്ധിമുട്ട് അനുഭവപ്പെടുക എന്ന് പറഞ്ഞാൽ അത് ഇന്നും എന്തോ മുഷിപ്പായിട്ടാണ് ആൾക്കാർ കാണുന്നത്. അല്ലെങ്കിൽ തലയിൽ മുണ്ടിട്ട് നടക്കുന്ന അവസ്ഥ, അല്ലെങ്കിൽ വളരെ നാണക്കെട്ടായിട്ട്. ഞാനൊരു ചെറിയ കാര്യം പറഞ്ഞുതരാം. ഇപ്പൊ 2 ദിവസം മുമ്പാണ് എന്റെ ഒരു ഡിസ്റ്റന്റ് ആയിട്ട് അറിയുന്ന നമ്മളൊരു പരിചയത്തിലുള്ള ഒരു സ്ത്രീയാണ്. അവര് വിളിച്ചിട്ട് പറഞ്ഞു അവരുടെ മകളെ കല്യാണം കഴിച്ചിരുന്നു. കല്യാണം കഴിച്ചപ്പോൾ മകള് ഒരു ആൻസൈറ്റിക്ക് എന്തോ ചെറിയ മെഡിസിൻ കഴിച്ചിരുന്നു. അപ്പൊ അത് ഹസ്ബൻഡിനോട് പറഞ്ഞു കഴിഞ്ഞു. അപ്പൊ ഹസ്ബൻഡ് പറഞ്ഞു അതിനെന്താ കുഴപ്പമൊന്നുമില്ല, നീ കഴിച്ചോന്ന് പറഞ്ഞു. കല്യാണം കഴിഞ്ഞ് 2 മാസം കഴിഞ്ഞപ്പോ ഹസ്ബൻഡ് പറഞ്ഞു ഇനി അത് കഴിക്കണ്ടെന്ന് പറഞ്ഞു. ആ പെൺകുട്ടി കഴിക്കൽ നിർത്തിയപ്പോ തന്നെ പെട്ടെന്ന് എന്ത് മെഡിസിൻ ആണെങ്കിലും നമ്മൾ കഴിക്കുമ്പോൾ ഒരു ഡോക്ടറോട് ചോദിക്കാതെ നമ്മൾ നിർത്താൻ പാടുണ്ടോ? ഷുഗറോ പ്രഷറോ ഈവൻ പനിക്കുള്ള ഒരു മരുന്ന് അല്ലെങ്കിൽ എന്ത് സാധനമാണെങ്കിലും അത് നിർത്തിയാൽ അത് അതിൻ്റെതായ സിംറ്റം കാണിക്കുമല്ലോ. അത് നിർത്തിയപ്പോ കുട്ടി അതിൻ്റെതായ സിംറ്റംസ് കാണിച്ചു. അതിന് വീട്ടിൽ കൊണ്ടുവന്നാക്കി ഡിവോഴ്സും കഴിഞ്ഞു. അപ്പൊ മെന്റൽ ഹെൽത്ത്. എന്നാൽ ഇതേ സമയം ആ വീട്ടിൽ തന്നെ ഈ അമ്മ പറയാണ് അവരുടെ വേറൊരു മകളുണ്ട്, ഭർത്താവിന്റെ ഈ കുട്ടിയുടെ കല്യാണം കഴിഞ്ഞ ആളുടെ വേറൊരു ജ്യേഷ്ഠൻ. അപ്പൊ അവരുടെ ഭാര്യയ്ക്ക് ഇതുപോലെ വേറെന്തൊക്കെ അസുഖങ്ങൾക്ക് മരുന്ന് കഴിക്കുന്നുണ്ട്. അവരുടെ ശരീരമൊക്കെ ഒരുപാട് വണ്ണം വെച്ചു. അത് കുഴപ്പമില്ല. നമ്മള് മാനസികമായിട്ട് എന്തെങ്കിലും സാധനം വരുമ്പോ അതിനെന്തെങ്കിലും റെമഡി എടുക്കാന്ന് അപ്പൊ അത്തരം പൊളിച്ചെഴുത്തുകളും അത്തരം സ്റ്റിഗ്മകളെ മാറ്റിയെടുക്കാനൊക്കെ നമ്മളെ കൊണ്ട് സാധിക്കണം. അപ്പൊ ലെറ്റ്സ് മൂവ് എന്ന് പറയുമ്പോൾ നമ്മളെ കൊണ്ട് പറ്റുന്ന ചുവടുകൾ എന്താണ്? ഇതൊക്കെയാണ് സമൂഹത്തിന്റെ അടുത്ത് അവയർനെസ്. സംഭവിക്കാനോ അല്ലെങ്കിൽ ഇളക്കി മറിക്കാനോ നമ്മളെ കൊണ്ട് പറ്റില്ല. പക്ഷെ നമ്മുടെ അടുത്ത് നമ്മുടെ ചുറ്റുപാടുകളിൽ ചില മൂവ്മെന്റ്സ് വരുത്താൻ നമ്മളെ കൊണ്ട് സാധിക്കും. അപ്പൊ അതിന് വേണ്ട മൂവ്മെന്റ്സ് നമ്മുടെ ഭാഗത്തുനിന്ന് ഉണ്ടാവുക. അപ്പോൾ ഇതിനെ കുറിച്ച് സംസാരിക്കാന്ന് മാത്രമല്ല, ലെറ്റ്സ് മൂവ് ഫോർ യുണൈറ്റഡ് ഫോർ ഗ്ലോബൽ മെന്റൽ ഹെൽത്ത് ടീമിന്റെ ഈ ഒരു വിർച്വൽ മാർച്ചിന് വേണ്ടിയിട്ട് അവർ തയ്യാറാക്കിയ ഒരു വീഡിയോ ഉണ്ട്. ആ വീഡിയോ നിഖിൽ പ്രസന്റ് ചെയ്യും. അപ്പൊ അതോടുകൂടെ സംസാരം ഞാനിവിടെ നിർത്തുകയാണ്. നിഖിൽ പ്ലീസ് വീഡിയോ. താങ്ക്സ് ഇൻ അഡ്വാൻസ്. ഓക്കെ, ശ്രദ്ധിച്ചതിന് ഒരുപാട് നന്ദി.
The world is talking about mental health, but talking is not enough. We need movement on mental health. Most people cannot access mental health support. Up to 90% are not able to receive the care they need, especially in low and middle income countries. In 10 years, depression will put more burden on our nations than any other disease. And the COVID-19 pandemic has made things even worse. This World Mental Health Day, the world will come together to move for mental health, move for investment, for access to support, for rights. Move with me in the world's first virtual 24-hour global march for mental health. It's time for leaders to hear our call. It's time to move for mental health.
Thank you, students, for that cheering presentation. Nitha, for that encouraging and insightful words. Before we move on, I request all of you to fill the feedback form that will be put in the chat box. Next, we have a story prepared by Henna from second year psychology.
അതെ, എല്ലാം പെട്ടെന്നായിരുന്നു. വീട്ടിലേക്കുള്ള മടക്കയാത്രയിൽ ഒരുപാട് പ്രതീക്ഷകളായിരുന്നു. ഒരു യാത്ര പോകണം, പഴയ കൂട്ടുകാരെയൊക്കെ കാണണം, വെക്കേഷൻ ആവാൻ കാത്തിരുന്ന ചില കല്യാണങ്ങൾ, എല്ലാം മാറ്റിവെച്ച് നന്നായി തുടങ്ങണം. അങ്ങനെ നീണ്ടുപോകുന്ന ലിസ്റ്റ്. അറിഞ്ഞിരുന്നില്ല മൂടി വെക്കേണ്ടത് വായക്കും മൂക്കിനുമപ്പുറം ചില സ്വപ്നങ്ങൾ കൂടിയായിരുന്നുണ്ട്. അറിയില്ല എന്റെ കണ്ണിലെ ഊർജ്ജം നഷ്ടപ്പെട്ടതെന്തെന്ന്. സന്തോഷം നൽകുമെന്ന് പ്രതീക്ഷിച്ച നീണ്ട ഇടവേളകൾ കുത്തി നോവിപ്പിക്കുന്ന പോലെ. ആകെ ഒരു മടുപ്പുകൾ. വൈകി എഴുന്നേൽക്കുന്നത് കൊണ്ടാവാം ഉറക്കമില്ലാത്ത രാത്രികൾ. തലങ്ങും വിലങ്ങും മാറി മാറി കിടന്നു നോക്കി. ഒരു രക്ഷയും ഇരുന്ന് കിടന്ന് ഇരുൾമൂടിയ മുറിയേക്കാൾ ഇരുട്ടുള്ള ചിന്തകൾ പലതും വന്നു. ഭാവി എന്തു എന്നതിലുപരി നിലനിൽപ്പ് എന്തിന് എന്ന ചോദ്യചിഹ്നങ്ങൾ പോലും. പതുക്കെ എപ്പോഴോ മയങ്ങിപ്പോയി. ഇങ്ങനെ എത്ര ദിവസങ്ങൾ അറിയില്ല. അപ്പുറത്തെ വീട്ടിലെ ചേച്ചിയോട് അകലെ നിന്ന് അല്പം സംസാരിച്ചു. വേണ്ട, അവൾക്ക് ഇഷ്ടമായില്ലെങ്കിലോ? എന്താല്ലേ, ഇങ്ങനെയുള്ള ചിന്തകളൊക്കെ വരാൻ ഒരു കുഞ്ഞു വൈറസ് മതിയല്ലേ. ഇടയ്ക്കിടെ നോട്ടിഫിക്കേഷൻ വരുമ്പോൾ പതിവ് പോലെ തുറന്നു നോക്കണമെന്ന് തോന്നിയില്ല. എനിക്ക് എന്താണാവോ പറ്റിയത്? എല്ലാവരോടും ദേഷ്യം തോന്നുന്നു. ഒരു പുഞ്ചിരി നടിക്കാൻ പോലും കഴിയുന്നില്ല. എന്തിനേറെ പറയാൻ, ഒന്ന് കരയാൻ പോലും പറ്റുന്നില്ല. ആരോട് എന്തു പറയാൻ? ഇതൊക്കെ ഒരു പ്രശ്നമാണോ? കണ്ടു പകർത്തിയ മൊബൈലിലെ ചിത്രങ്ങളിലൂടെ വലിയ താല്പര്യമില്ലാതെ കണ്ണോടിച്ചപ്പോഴായിരുന്നു അവളെ ശ്രദ്ധയിൽപ്പെട്ടത്. 5-6 വർഷം ഒരുമിച്ച് പഠിച്ചതാ. കുറച്ചായൊരു വിവരവും ഇല്ലാത്തത്. നല്ല കൂട്ടായിരുന്നു. സങ്കടങ്ങളൊക്കെ പറയുന്നതാ. വെറുതെ ഒന്ന് വിളിച്ചാലോ, ഉള്ളിലുള്ളതൊക്കെ തുറന്നു പറഞ്ഞാലോ. അവളുടെ നമ്പറിലേക്ക് വെറുതെ ഒന്ന് കുത്തി നോക്കി. ഒറ്റ റിങ്ങിൽ തന്നെ എടുത്തത് വളരെ സന്തോഷിപ്പിച്ചു. നീ എന്താ വിളിച്ചത്? നിന്നെ ഇന്നലെ ഓർത്തേ ഉള്ളൂ എന്ന വാക്കുകൾ ആകാംക്ഷയുളവാക്കി. എന്താ എന്നെപ്പറ്റി ഓർത്തത് എന്ന ചോദ്യത്തിൽ നീണ്ട ആ സംസാരം അവസാനിച്ചത് പഴയ നല്ല കാലങ്ങളിലേക്കായിരുന്നു. നീണ്ട സംസാരത്തിന്റെ വിരാമത്തിൽ അവൾ വീണ്ടും ചോദിച്ചു, നീ വെറുതെ വിളിച്ചതായിരുന്നു എന്ന്. പെട്ടെന്ന് എന്നിൽ ഒരു തിരിഞ്ഞു നോട്ടം നടത്തി. എന്റെ കണ്ണുകൾ വീണ്ടും തിളങ്ങുന്നുണ്ടായിരുന്നു. എന്റെ ചുണ്ടിൽ പുഞ്ചിരി ഉണ്ടായിരുന്നു. പറയാൻ ഞാൻ ആഗ്രഹിച്ച അലോസരപ്പെടുത്തലുകൾക്ക് വിരാമം കുറിക്കപ്പെട്ടിട്ടുണ്ടായിരുന്നു. ഒരു ദീർഘശ്വാസമെടുത്ത് പുഞ്ചിരിച്ചുകൊണ്ട് പറഞ്ഞു, വെറുതെ വിളിച്ചതാണ്. സ്നേഹത്തോടെ അവൾ മറുപടി പറഞ്ഞു, ഏതായാലും നീ വിളിച്ചത് നന്നായി. മനസ്സിനൊരു ആശ്വാസം പോലെ. വാക്കുകൾക്കും സ്ഥാനമുണ്ടായിരുന്നില്ല. പുഞ്ചിരിയോടെ ആ ഫോൺ കോൾ അവസാനിപ്പിക്കുമ്പോൾ ഊഹിക്കാം, അതേ പുഞ്ചിരി അവളിലും ഉണ്ടായി കാണണം. ഇതൊരു കഥയ്ക്കപ്പുറം ഒരു ഓർമ്മപ്പെടുത്തലാണ്. മാറുന്ന ജീവിതശൈലിയിലും മാറ്റമില്ലാത്ത ചില ബന്ധങ്ങളുണ്ട്. അവ ചേർത്ത് പിടിക്കാം, പരസ്പരം താങ്ങാവാം, നാം അതിജീവിക്കുക തന്നെ ചെയ്യും. താങ്ക് യു.
Thank you, Henna, for that inspiring story. It truly touched our hearts. Next, we have a poem recitation by Aparna Shankar of 2nd BSc Psychology.
They said it's all in my head. That's not what I wanted to hear. They said everyone goes through it. That's not what I wanted to hear. They said I'm being dramatic. They said I'm being negative. They said I'm thinking way too much. That's not what I wanted to hear. I wish there was more sunlight. I wish there was no judgment. I wish I could have an unashamed, open conversation about the emptiness, the loneliness I feel when I'm with or without everyone. About how scared I am to admit how hollow and meaningless my life gets. About how to shut my own self-depriving thoughts. I wish I looked sick so that I don't have to explain it's real. I wish they taught this in school so that I can do it all by myself. Because mental health is not an option. It's essential.
Thank you, Aparna, for that soulful poem. Let this day remind us that such words untold are to be told and shared. The students of Amal College of Advanced Studies, Nilambur, have been a part of our institution from the beginning of this academic year. As a part of today's program, the 3rd BSc Psychology students have prepared a short film which will be presented now.
പെട്ടെന്ന് ഇതൊക്കെ എന്റെ തലയിൽ ഇട്ട് പോയാൽ ഞാൻ ഇതെന്ത് ചെയ്യാനാ? ഉണർക്കാണി പോയാൽ മതിയല്ലോ, നല്ല സുഖാണല്ലോ. രാവിലെ ഇതിന്റെ ഉള്ളിലേക്ക് കയറിയാ പിന്നെ വൈകുന്നേരം കിടക്കാൻ നോക്കിയാൽ മതി. അതുവരെ ഇത് ഒതുങ്ങണം. എല്ലാം ഒറ്റയ്ക്ക് ഇങ്ങനെ വയ്യ. അവിടെ ഭ്രാന്ത് വരുന്നു. പോയിട്ട് വന്നിട്ട് 2 ആഴ്ച. അതിനിടയിലൊന്ന് വിളിക്കേ, നിന്റെ കാര്യം അന്വേഷിച്ചോ, വീട്ടിലെന്താ നടക്കണേന്ന് അന്വേഷിച്ചോ? ഒന്നുമില്ല, ഒന്നും അറിയണ്ടല്ലോ അല്ലേ. ഞാനുണ്ടല്ലോ എല്ലാം നോക്കാൻ. ഞാനെങ്ങനെ കോളേജ് ഉണ്ടെന്നുണ്ടെങ്കിൽ ഒരു ആശ്വാസം. ഒറ്റയ്ക്കെങ്കിലും അറിഞ്ഞല്ലോ. ഇത് പതിവും കഴിഞ്ഞു. ഞാനതൊക്കെ എവിടെ കാണാനാ? ഞാനതൊന്നും എടുത്തിട്ടില്ല. ഹലോ ഹലോ മോളെ, എന്തൊക്കെ എന്റെ മോളെ വിശേഷങ്ങളൊക്കെ? സുഖല്ലേ മോളെ? അങ്ങോട്ട് വിളിക്കണം എന്നും കരുതും. കൊറോണ പേഷ്യൻസ് ആണെങ്കിൽ കൂടുതലല്ലേ, അപ്പൊ ഞങ്ങൾ 3 നഴ്സുമാർക്കല്ലേ ഈ മാസം ഡ്യൂട്ടി. അതുകൊണ്ട് അങ്ങോട്ട് വിളിക്കാൻ പറ്റാൻ. സുഖല്ലേ മോളെ? ഇവിടെ മോളെ കാണാൻ നമുക്ക് കൊതിയാണ്. നമുക്ക് സുഖാണ്. സുഖാന്ന് പറഞ്ഞില്ല.
അതെന്താ ഇങ്ങനെ? എന്റെ ചിന്തകളെല്ലാം ചീത്തയെന്നില്ലേ? ഞാനോട് പോയില്ല അങ്ങനെ. അല്ലെങ്കിലും എനിക്ക് ചിന്തിക്കാൻ പറ്റില്ല. ലോകം മുഴുവൻ ഈ വൈറസിന്റെ പിടിയിലാണ്. ഞാൻ നല്ല കാര്യങ്ങൾ ചെയ്ത് നല്ല ദിവസങ്ങൾ കൊണ്ടുവരാൻ വേണ്ട. ചുമ്മാന്റെ കുറവ് ഞാൻ ഇവിടെ വരുത്താൻ പാടില്ല.
Thank you so much, students of Amul College, for that meaningful video. And we are so grateful for your hard work, support, and gratitude for being here supporting us on this special day. Next, we all know that surely mental health can't be confined to a single day of celebration. A good mental health is a necessity every day of our life. So we have students of 3rd BSc Psychology with a video presentation on tips to enhance mental health.
Hi everyone, October 10 is the World Mental Health Day. As a part of that, we, the students of 3rd year psychology, has prepared a video for you. So do watch it and practice those techniques. Technique number 1, do yoga and meditation. By practicing yoga and meditation, you will be more relaxed and energized. Number 2, be sure to motivate yourself, even if nobody does it for you. You'll be more comfortable and inspired by motivating yourself. Number 3, somebody said that you are what you eat. So eat healthy food. Healthy food gives healthy body, thus healthy mind. Number 4, drink water as much as you can. It will not only hydrate your body, but keeps you moving throughout it. Number 5, get adequate amount of sleep. Sleep is the energy packet, and you'll be more refreshed in the morning. Number 6, say no, no, no to cigarette, alcohol, and drugs. That's a big no. Number 7, the sun. The sun is the ultimate source of energy. It is the packet of vitamin D. So get optimum amount of sunlight in the mornings and evenings. Number 8, do things that energizes you. Do things that makes you happy. And always put a smile on your face. You're never fully dressed without a smile. Number 9, talk to somebody, anybody when you feel down. Sharing feeling is a good way of calming yourself down. Number 10, note down your feelings. Get a paper and note it down. That will help you to manage your thoughts and help you to make good decisions. So, thank you all for watching this. We hope this will help you. So stay happy and we are here with you. And do remember that you are your strengths and you are your weaknesses.
That was a very informative video. Thank you so much to everyone who worked behind it. It was beautifully presented. Once again, I repeat, please fill the feedback form that is put in the chat box. Unfortunately, we've come to the end of this program, and therefore I invite Stefina for the vote of thanks.
Hello. Good morning, everyone. I believe we had an extremely useful session today. We have learned a great deal about mental health and what we can do to enhance it in our college enrollment. The duty vested in me today is the vote of thanks. First and foremost, I thank God Almighty, without whose blessings this event would never have happened. Next, I'd like to thank our college and especially our principal, Dr. Shaijan Paul, for giving us this opportunity to conduct this program and for his continued support and encouragement. I sincerely thank you, sir. Next, I would like to express my sincere gratitude to Dr. Mohammed Abeer, our resource person, who despite his busy schedule enlightened us on the importance of this day. Your words were really insightful and we were privileged to have you. Thank you, sir. Next, I would like to thank all the teaching and non-teaching staff who joined us today. I extend my sincere gratitude to the organizing secretary of this program, Dr. Suganya B. Menon, and the head of the department, Dr. Milu Maria, who helped us coordinate and organize this program successfully. I thank you from the bottom of my heart. Next, I would like to thank all the participants from our college as well as from Amal College of Advanced Studies, Nilambur, who took the time and effort to enlighten us with their programs. Next and most importantly, I would like to thank my fellow coordinators, Akshara KP from third year psychology, Bayana BV, research scholar, Radhika from second year psychology, Sriraj from second year psychology, Papiha from MSc psychology, our technical support team, Dr. Licho K. Joy, Ms. Susmi Johnson, and Nikhil Krishna from second year psychology, anchors Ashlyn Ruby and Gifty Baiju. My special thanks to Karthik from second year commerce and Deepika Shivanandan from third year psychology. I also wish to thank all the rest of my classmates, juniors, and the rest of my department for their sincere efforts. Now I thank each one of you who joined us in this program, especially students from Amal College of Advanced Studies. I sincerely thank you all from my bottom of my heart. Thank you and have a nice day.
Thank you so much. With that, we have come to the conclusion of the program. I hope we were able to sow a seed on the importance of Mental Health Day or mental health into your minds. Before you leave, please make sure that you have filled the feedback form posted in the chat box. And also, I wish you all a pleasant day. Thank you.